Good morning, everybody, and welcome back. Today is the part 2 of our Principle of Toxicology. So this morning we will continue with where we left off last week. Here's the Principle of Occupational Toxicology. Hope that you all have a nice week already. And today we are going to focus on two substances, looking at metals and chemicals only. We are not here to basically to be explaining everything about all the toxicology of all the substances, but just the basic concept and how can you assess the information and how do you use the information in your daily practice. I'm sure all of you know this periodic table. So today, the metals we're going to be focusing on is going to be lead, mercury, cadmium, nickel, and arsenic. So these are some of the common metals and or metalloids that are present, that are used in the industry, and some of them that are main cause of occupational related diseases or occupation related issues. Some of them actually also focus on environmental health issues. So it's important for us to look at it from two perspectives. So environmental and occupational health issues. So we focus on look at the chemical. Of course, we understand chemical can come in three forms. They can basically exist as a metal, as an elemental metal, as a basic chemical form, but usually they will come in either organic or inorganic form. So in nature, there is basically very rarely you get a pure metal form without reaction to other chemical. So of course we understand that any chemicals, any metals you're exposed to, it basically will lead you to two kind of toxicity: acute toxicity and chronic toxicity. So acute toxicity usually occurs near when the organ is affected, involve absorption or elimination of the metal. So usually it's either the lungs or the kidney or the liver, where basically there's absorption, metabolism, and excretion of the chemical or the metals. We know that from when you talk about acute toxicity, we look at the issue of whether there is a higher dose of a chemical that has been absorbed for a shorter period of time. So when you look at acute toxicity, basically you look at chemicals that entered at a higher dose, and the elimination itself is not fast enough to basically excrete the metal from or the chemicals from the body. So the toxicity actually can persist or can become chronic if there's a problem. But we talk about chronic toxicity, basically there's a long term. Usually we focus on more on other areas where the chemicals are actually being stored. So chronic toxicity, long and repeated exposure of more small doses. Organ involved usually is not the absorption or elimination, but basically more other system like hemopoietic or your blood system and immune system may be affected. Sometimes it's your neurological also can be affected, like your brain, so central nervous system or your peripheral nervous system. So remember this diagram which we showed last class. Basically this one talk about how the chemicals enter the bodies and how fast it's excreted. So chronicity means that the chemicals can actually stays in the body and then it is stored in tissues, and that tissues basically will be the one that is affected by the chronic exposure to the chemical. That means the chemicals are still present. This is just an example using sodium thiopental, which is a barbiturates, which of course barbiturates, we know that there is a short-term chemical and not long-term chronic exposure. But this is just an illustration that is what happened when you talk about chronic or acute exposure. So you need to consider two components. Basically, what is the target organ, what is the absorption organ, and also what are the how fast is the chemical being excreted from the body. That means the half-life of the chemical, and also where are the chemicals stored in the body. So that are the issues that you need to look at when you're talking about exposure to chemical or metals in there from environment or occupational exposure. So we move on to lead. All right, so lead, what is lead? Lead basically is plumbum or lead. It consists of 1 to 11% of ores. So it's the richest ore is galena. All right, no useful biological function in human. That means this is not useful in human. We know that some other metals are useful in human, like iron. Iron is basically required in hemosynthesis. That's why you take iron sometimes if you have low hemoglobin level. The doctor will prescribe you with a iron tablet. But lead itself, there's no biological value in the human body, so that means it does not function, does not form or function as any beneficial value to the body. The lead can come with, of course, we know that elemental lead, but it's not really common. So most of the time it's either inorganic or organic lead. So inorganic lead, basically you have permanent oxide, dioxide, trioxide, or other lead basically combined with other metals like arsenic. And of course, the second one is the organic lead. Organic lead are basically liquid compound of the lead, where basically they can be absorbed more easily because of the organic nature or the lipophilic nature of the lead itself. So two of the common one is tetraethyl lead and tetramethyl lead. These are called organic lead. We will discuss this more in detail in this class. All right. So where can you find lead in the workplace? Battery manufacturing, chemical industry, construction industry, demolition work, firing range instructor, foundry workers, petrol station attendant, gasoline additive product, jewelers, lead mines, smelters and refiners, pigment manufacturer, pipe fitters, plastic industry, pottery work, painters, radiator repair, rubber industry, soldering or lead products, solid waste production, stained glass maker and welders. So from the list itself, you know that there is extensive use of lead, or basically sometimes it's not use of lead, but extensive lead are basically present in a lot of industry, and that is important for us to know that lead exposure usually is very common, and we need to reduce lead exposure. So this is basically shows a diagram of how battery is manufactured. So this is workers lading molten recycled lead into billets of lead acid recovery facilities. So basically, batteries are also manufactured in the same way. So lead is basically melted or smelted, and then it forms the plate, and also it forms the cathode and anode connector in the battery form. So everything is liquid form, and it is basically, and there is fume generation. So lead is extremely toxic substance, and workers must protect themselves in this effect. So if you're basically handling lead, you need to wear the proper personal protective equipment. In this case, basically, it is more focused on cartridge respirator, or because that can protect you against lead, because lead is more of fume hazard. Lead also can be found in non-occupational exposure. That can be found in traditional remedies. All right, and we know that some traditional Chinese medicine have lead in it, and some of it basically, if we find lead, basically we would just remove it from the market. But sometimes some traditional medicine does come through, and they have lead in the medication. Of course, we have what we call leaded containers, and also not in home area, but in some industry, they use leaded paint. So deterioration of leaded paint, and lead containing dust, lead containing residential soil, and the last is air pollution. So lead is present in both organic and inorganic form in air pollution. But currently it is less because we have moved away from using leaded petrol. That's why the lead exposure is less compared to previously. So these are some of the leaded container. All right, on your left is basically leaded vessels used to store water, and also sometimes they used to store wine. During the time of Roman time, they say that when you store wine in a leather container, it tastes sweeter. So that's why a lot of people drink wine in leather container during Romans time. On your right, you can see there is crystal, all right, which have 24% lead in there. Can anyone explain what is the use of lead in crystal? We know that when you put lead in leaded vessels and when you put water or put wine or put food in it, basically the lead would be leaching out of the container. So why do they put lead in crystal?
To make it more not easy to broken, something like that.
Broken?
Yeah.
No.
Scattered. No.
Not broken.
I'm not sure.
Right.
So
Anyone
that
else?
it doesn't react with the container?
Sorry?
So that it doesn't react with the container?
Why? Why it doesn't react with the container?
I mean, in the glass.
But lead is there in the glass. Firstly, is it dangerous or not? We know that when you put lead in a leaded vessel like this, all right, there is some danger when you put water, put wine, or put any kind of liquid or food into it. The lead will basically leach out from the container. For this type of crystal, what is the danger? Anyone?
I think, Prof, having lead in a crystal will never leach out the lead from the crystal, first of all, and maybe it was being used for shining or something like that.
Okay, so basically lead is put in crystal to make it harder so that you can actually so the idea of lead in a bound form is in a glass is not dangerous. Basically it's bound in the glass itself, and for usually glass container, we are not worried about glass container is safe because the lead doesn't leach out. So very good, Uma, lead doesn't leach out from the glass container. The use of lead in glass container, especially crystal, is basically make it hard so that you can actually form it and make patterns in a glass container. But the problem is basically the risk is only for people actually working and producing leaded crystal containers. So that is where the exposure is. But for any other leaded container, all right, there's to be leaching out of the container. So how do you know it's leaded or not? Basically, all pewters in the older days, these are basically pewters actually. So pewters have lead in it at some point of time. So you must be careful when you're using old container. Whether there's lead or not. The other source of lead in the kitchen is basically from those colorful porcelain plate. Have you seen colorful porcelain plate where there's red color, blue color porcelain plate? So those also contains lead. So those also are quite dangerous if you want to use it as a container. So the best is to use less colorful container if you want to. The other source of lead, of course, we know that some of the old vehicle actually contains lead, and some of these paint actually are leaded paint. So some of your old toy car does contain lead. So that is but currently it's all cast iron, and the paint are basically lead-free paint. But the older one, they do contain lead, especially those bright color car. They do contain lead because lead make the thing more shiny compared to other metals. So what are the health effects of lead? So basically, lead can basically cause a central nervous system defect. Basically, it's the most sensitive target organ. So it's either can affect central nervous system or your peripheral nervous system. So central nervous system in children is more affected because we know that the child growing up, their brain are still in the forming stage. So then their blood-brain barrier is not fully formed yet. So there is more effect if the child is exposed to lead. So in a child that's exposed to lead, you can have neurological deficit at low dose, lower IQ, cognitive deficit, reading disability, deficit in vocabulary, fine motor skill, and also high frequency of hearing loss. Sorry, high frequency hearing loss. So that is the exposure in lead, for lead for an effect on central nervous system, especially in children. Currently, there's not much problem with lead exposure in children because we have changed it from leaded to unleaded petrol. So nervous system, of course, this is just to highlight that what is the difference between central nervous system and peripheral nervous system. So the central nervous system consists of your cerebellum and which is your cerebrum and cerebellum. So your brain, your brain, and all these are your central nervous system. So your peripheral nervous system will start from your spinal cord, and in peripheral nervous system we have both autonomic and somatic. Autonomic means that the function of the nervous system is automatic and is not controlled by your will, and of course somatic, we know that basically your muscle movement is controlled by what you think. So that's called somatic and autonomic. So it's the central nervous system and peripheral nervous system, just to highlight the difference. So in adult, what will happen? Adult, basically there's subtle behavior changes, fatigue, impaired concentration, neurobehavioral changes, and of peripheral nervous system you have motor sensory neuropathy and wrist drop in late stage. Wrist drop means that because of the peripheral nerve being affected, the nerve conducting to the wrist is basically reduced, and the muscle controlling the muscle is defect, so you actually your wrist actually drop like that, which is difficult for you to extend the wrist. This is called extension. This is called flexion. Basically, your wrist will be in flexion, and then it's difficult for you to extend the wrist because of the effect to the peripheral nervous system, which is the nerve connecting to your wrist itself. So you can get wrist drop. Of course, you can get foot drop also in the late stage, but more commonly wrist drop. So second health effect is basically looking at the hematological or blood. So it causes anemia. Anemia basically is the decrease in the red blood cell. So it can cause both two types of anemia, acute or chronic. Acute is hemolytic anemia. Hemolytic anemia means that the red blood cell breaks down more easily. So you get hemolytic or hemolysis or bleeding. But this type of bleeding is within the blood vessels itself. So where the red blood cell breaks down more easily. And chronic, it affects hemoglobin formation component of cells. We remember from the first class that hemoglobin is required for the transportation of oxygen, for us to transport oxygen from the lung to the organ that we want to use it. Endocrine is basically looking at production of hormones and vitamins. So when endocrine is affected, there is also decrease in vitamin D. Vitamin D required for maintain level of calcium in the cell, and this will affect cell growth, teeth maturation, and also bone development. So we will look at some of these. So these are more when you are in the younger age group, when you're developing, lead become more of a problem compared to your adult, but it's still a problem when you're adult. This is just to show you that the basophilic stripping in the red blood cell. So this is your red blood cell, normal red blood cell, and this is called basophilic stripping of the red blood cell, where there is lead inside the red blood cell itself. So that is what it is, and you look at it because of drinking decorated with lead paint. All right, we've been drinking from glasses decorated with lead paint, so there's lead paint there. So that's why you must be careful when you especially use those old container, whether there is lead there or not. All right, so that is important for you to look at it. Now, other health effect: reproductive and developmental, rapid course of placenta, affect viability and development of fetus, which leads to abortion, stillbirth, low birth weight, and premature delivery. And also it can affect the fertility in male because it reduces the sperm count and reduces the sperm motility. So for male fertility, there's two things that is important: the number of sperm and also the viability of the sperm. So viability of the sperm is measured by the sperm motility, basically how fast can the sperm swim. Renal is where the lead is basically being excreted, and it causes neuropathy. Nephropathy, basically it affects the nephron or the organs within the kidney that is used to filter out water, filter out substance that to create urine. So that's called a nephron. So basically it causes nephropathy, inflammation of the nephron, and it become nephron defective. And also lead is considered a carcinogen, and IARC class 2B, which is considered a possible carcinogen. Anyone know what's IARC? Anyone have idea of what does IARC means? Are you there?
International Research,
Yes,
International Agency for Research on Cancer.
All right, very good. So International Agency Research on Cancer, and what do they do? Anyone? Anyone knows what they do?
Conduct and coordinate research into the cause of cancer.
Basically, they review. What they do is they most of the time they are based in France. All right. So IARC is based in France. So they review all the documentation. Every year they will review all the documentation that is available on cancer, and then after reviewing all the documentation that's available on substances that can lead to cancer, they will classify it under 4 classification: IARC 1, IARC 2A, 2B, IARC 3, and IARC 4. So that's what is their role. So every year they will basically look at different chemical or different substances and see whether what is the probability or possibility of cancer. So, all right. So this is to show that X-ray demonstrating the characteristics of findings of lead poisoning in human. So this is a dense metaphyseal line. So this is basically young kid when they're exposed to lead, and because the bone is still forming, then you get the metaphyseal line, and this is basically it would not fuse, and then you will have problem in bone growth. All right. So basically it shows the X-ray in a younger person who's basically exposed to lead. So this is IARC. So as I mentioned earlier, International Agency for Research on Cancer. So group 1, group 2A, 2B, 3, and 4. So group 1 basically are what we call non-carcinogen. So every year they will be looking at the research and classifying what is considered as a carcinogen to human. And 2A is probable carcinogen, 2B is possible carcinogen, and 3 is basically all chemicals that are considered not classifiable to is carcinogenic to human, and 4 is probable not carcinogen to human. So the idea is that there is these 4 classification, and when we look at it, we are worried about 1, 2A, and 2B. Although 3 is not considered carcinogen, but basically it means that the chemical has not been considered, and it has not been classified as whether it's carcinogen or not. So these are the things. So it's updated every year. This is 2012, 2015, and this is 2020. So you can see that the number that is related to the number of carcinogen from 108 to 117, and currently is 121. So the number increases every year, and I don't know why this year they have removed the chemical that is considered non-carcinogenic, which is IARC group 4. So the first thing you have to look at when you look at chemicals, you must look at the IARC, whether it is carcinogen or not, or whether it's probable carcinogen or possible carcinogen. So 1A, 1, 2A, and 2B, we are at, when you're exposed to in the workplace, we consider that as carcinogen. So just now when we talk about the renal carcinogen, is possible carcinogen to human, so it's considered under 2B. So which means that there is a possibility that we are exposed to the chemical, basically you will get carcinogen. So possible carcinogen, usually when we talk about possible carcinogen, there is evidence in animals, but there's still lack of evidence in human. That's why it's called possible. Probable is both evidence in human and evidence in animal, but there's not much evidence in human. And carcinogen means there's solid evidence that in human that the chemical can cause carcinogen. It is not just chemical, but also substances, not just substances, but also exposure to hazard like UV radiation. All right, so radiation is basically physical hazard, and physical hazard can also cause carcinogen, and UV radiation is considered carcinogen. Of course, at one point, I think 2-3 years back, they also classify red meat as carcinogen. So people that eat red meat can have considered as carcinogen. So the thing is, it is classified carcinogen, and if you are exposed to in the workplace, then you need to be the chemicals need to go under chemical health risk assessment, and you need to reduce the exposure of the workers to all those chemicals and in the workplace. Any questions so far? Are you okay?
Okay, sir. Okay.
All right. Okay, so we can continue. So just now we discussed basically on the effect of lead. Most of the time we're talking about the effect. We are talking about effect of inorganic lead earlier. So it can affect the nervous system. It can affect the peripheral. It can affect the central nervous system, peripheral nervous system, renal, bone, and other organ. All right. So when we talk about organic lead is used in occupational exposure. Is used as an anti-knocking agent in gasoline. All right. Anti-knocking means basically incomplete combustion. So or uncontrolled combustion is called knocking. So earlier to reduce that, they actually add in a tetraethyl lead or tetramethyl lead to for into the petrol or into the gasoline to reduce the knocking knocking effect of the petrol. Right. So toxicokinetics, of course, we know that organic, when we consider organic, we also consider it as water soluble, fat soluble, and also it's volatile. So is it absorbed through skin and inhalation? So this is lead petrol, all right. So USA phased out leaded gasoline in 1986. When did we do it? Anyone know or have read that when have Malaysia recently removed gasoline? Do we still have leaded petrol here? Any one of you not from Malaysia? Anyone here not from Malaysia? Anyone? Okay, Wang, not Wang. Wang, you're not from Malaysia? You're from China, is it? I think China don't use leaded petrol. All right. Some other countries. Fakri, where are you from?
Indonesia, sir.
Indonesia also don't use leaded petrol, correct? Or you still have leaded petrol? Do you remember? Fakri? Do you have leaded petrol in Indonesia?
Probably, sir. Not really.
So basically, Malaysia phased out leaded petrol around 1990s, all right? So 1998, Malaysia oil firm to phase out leaded petrol. when in 1998. So by the year 2000, basically we stopped having leaded petrol. So the idea is that why did we phase out leaded petrol? Because leaded petrol considered petrol with lead considered affect the growth of and also the cognitive ability of the kid. Right, so health effect, acute exposure, central nervous system effect only, convulsion, delirium, coma, death, depression of vital brain centers, chronic exposure, disturbance of thoughts, hallucination, loss of memory, insomnia, deterioration of personality. So anemia and peripheral neuropathy does not occur when you're exposed to organic lead. So inorganic lead only would affect your anemia, your hematological system, and also your peripheral nervous system. But inorganic lead also affect your central nervous system, but organic lead basically affect your more towards your central nervous system. So symptom of organic lead, if you have mild exposure, you have myalgia. Myalgia basically is muscle weakness, irritability, paresthesia basically is a loss of sensation, mild fatigue. Fatigue is basically something like you're feeling tired. Intermittent abdominal pain. So abdominal pain that is considered a problem if you are exposed to lead. And lethargy is basically the same as your mild fatigue. So lethargy and mild fatigue, you're feeling tired all the time. So the main mild, you have a myalgia, weakness, muscle weakness, paresthesia, loss of sensation, mild fatigue, and lethargy, and also intermittent abdominal pain, pain in the abdomen. Moderately exposed to moderate amount of organic lead, you will get headache, tremors. Tremors is basically your hand there's a tremor in your hand or shaking in your hand, vomiting, general fatigue, diffuse abdominal pain, weight loss, loss of libido, and constipation. Libido means your desire to have sex. It's called loss of libido. And severe, you can have encephalopathy. Encephalopathy is basically inflammation of the brain, and it causes you motor neuropathy, your weakness of the motor muscle, weakness of your muscles, seizures, coma, abdominal colic. Basically, abdominal colic means the worsening of the abdominal pain, where your abdomen become colicky, and lead lines around the gums and lead lines, and that you can see. Oliguria is where your kidney fails, and that is where you become there's decrease in urine formation. So it's basically is a sign of kidney failure if you have severe lead toxicity. So we know that lead is basically exposure to lead are associated with antisocial behavior. So in the 2002 publication, basically exposure to lead in childhood could lead to antisocial, even criminal behavior in adults. A study suggests that first comprehensive lead study to track children over a period of time found that both prenatal and postnatal exposure to lead were associated with antisocial behavior in children and adolescents later on in life. So this blood lead level in children globally, what is the safe blood lead level in children is basically less than 5 microgram per deciliter is the safe lead level in children. So globally, WHO estimated that 40% of children have blood lead level of more than 5 microgram per deciliter. In the US, this is quite this is in 2000, 535,000 children have blood lead level of more than 5 microgram per deciliter, and 150,000 children have blood lead level of more than 10 microgram per deciliter. So if you look at it, the research has found that if blood lead level of more than 3 microgram per deciliter, we have deleterious effect on the academic performance. That means your academic performance will basically be affected if you have high blood lead level. When your blood lead level becomes higher, you have considered have a criminal behavior. So lead itself is basically important for you to reduce the blood lead level in the child or environmental exposure to lead. So this table actually shows the changes in lead level in Sweden and the type of gasoline between 1917 and 2000, and the mean blood lead level among elementary school children in Sweden between 1978 and 2000. If you look at it, the level is actually associated with the decrease in the level of gasoline, lead level in gasoline. So the blood lead level in children is associated or correlated with the blood lead level that is present in the petroleum. So it's very, very distinctive relationship. This is called, there's a time difference between that, or time lag. So there's a time lag and of 5 years, and basically that's because it's children, the second children in elementary school. So this is when they are born. This is 5 years when they go to elementary school. So there is a very, very distinctive correlation between blood lead level and the level of lead in gasoline per deciliter. So the idea is that lead is basically present both in environmental and in occupational. The most common previously is basically lead present in gasoline, but now lead is still present in some paint and some toys, and that's why you need to, when you purchase any toys or any things for your child, you make sure that it is lead free. Currently, all the paints that is used for domestic paint, there is no more lead, but for paint that is present in industry, some of the industry, they still have leaded paint. And of course, the current one, there's no leaded paint. So we understand that this is not the, when the paint is basically bound and is bound, or the lead is bound to the paint, there shouldn't be a problem. But when the paint start deteriorating, that's where there's release of chemicals and release of substance that it causes the problem of lead. Of course, we have also people who is what we call doing recycling. All right, there's a lot of recycling issue. I have heard a lot of problem of recycling in Indonesia, recycling lead, cottage industry. Of course, this picture is not from Indonesia. This is basically a picture taken from WHO website. But I do have attended many conferences, a few conferences that basically discuss on less exposure among people in Indonesia. Maybe Fakri can share if you have any idea. Fakri, are you there? Where are you from?
Yes, sir.
Where are you from?
Pardon?
Where are you from?
Indonesia,
Which part? Sorry.
Jakarta.
Jakarta, yeah. Jakarta is a big place, correct? I haven't been to Jakarta. I've been to Yogyakarta. I've been to Surabaya and Aceh, but not Jakarta. All right. So when we have a conference, that time was in I think in Surabaya. All right. We basically discuss about lead in when they recycle lead. So lead is basically present. If you look at this, lead is present as a fume. All right. And this is basically will cause you the environmental exposure of lead. And also lead is also present as in the soil because of there's a lot of lead here. So the idea of lead exposure is very, very pertinent in when you want to recycle lead. So it's good that it is always appropriate that when you want to recycle your battery, to send it to a recycling center that is approved by DOE. So in Malaysia, all lead or all recycling center for lead or leaded batteries need to be registered under the Department of Environment or DOE. before they can do lead recycling. But of course, we know there's a lot of people that doing lead recycling at the cottage level or cottage industry, so that is quite dangerous. So it's good that if you have a lead battery, make sure you send it to the, or when you leave it at your mechanic, make sure it is going to be sent to a certified recycling center or registered recycling center. So this is the problem in a developing country where they recycle lead, and there's still a lot of lead present, because you look at the amount of lead, it can be between 1 to 11% of your soil in the, that contains the lead. All right. Any question on lead? Any issues? Anything you want to discuss? So what is the lead? Basically, lead is, these are, when we talk about toxicology, we only talk about the lead exposure and effect of lead. So later on, when we talk about more about occupational diseases or exposure or lead effect, we will discuss on the level of lead that is allowed under our what we call legislation in Malaysia. So are you okay so far? Any problem? Anything? Anyone want to discuss something? Ifa, are you okay?
Okay.
All right. So we will continue. All right.
Yes,
so
okay, Prof.
okay. So we completed lead. All right. Lead is still a problem. All right. So now we continue to look at arsenic. So arsenic basically is another metalloid. This is found in the nature widely. So it is most abundant in sulfide ores. So it is associated with sulfide. Also, of course, if you look at it just now, it also can be associated, can be formed together with lead, your lead arsenic. So it comes in three groups. Basically looking at inorganic lead, organic lead, and also arsine gas. So inorganic lead is can become in a two form, trivalent or pentavalent. So trivalent, and then inorganic arsenic, it comes in two forms, trivalent or pentavalent. And trivalent include arsenic oxide, arsenic chloride, and pentavalent arsenic oxide to use in wood preservative and herbicide, and organic arsenic, and the last is arsine gas. So arsine gas is basically used in some semiconductor industry for manufacturing of circuit board in some semiconductor industry. So lead is also used in semiconductor industry. Is it correct? But currently, what they use is they use lead-free solder. So when you start soldering, also you have exposure to lead. So but now they use what we call lead-free solder. But lead-free solder is still lead. There's still lead there, but the amount of lead is basically reduced. All of you do use lead for soldering in your house. So that is also, you need to basically do it in a very open area where the ventilation is good, so that you ensure that you're not exposed to lead. So now we focus on arsenic. So what arsenic is basically is present throughout present extensively on the ground, and because it's present in the ground, so that you get exposed to it when you drink groundwater. So the other natural exposure includes when you eat fish, shellfish, or seaweed. Occupational exposure, broad spectrum, inorganic, smelters, ceramic industry, wood preservative. So if you look at it just now, arsenic also present as lead arsenic. So that's why if you do smelting, you can get exposure to arsenic. It's a ceramic industry, wood preservative. Arsenic is used as a pesticide and for preserving wood or other preservative from from the organism. So it's used as an insecticide, also as a herbicide. It's used as in textile industry as a drying agent, and used for manufacture of colored glass and also semiconductor. These are more of inorganic lead used in occupational exposure. So organic lead, herbicide, additive in animal feed, arsen gas, semiconductor manufacturing, DuPont, metal refining, the novel production when arsenic reacts with acid. So there is arsenic is used in arsen gas, and arsenic is used in many industry. The main issue also is present in naturally in a lot of places. So where can you find arsenic? In occupational exposure, manufacturing and use of pesticide, weed killers, fungicide, wood preservative in tanning or wood preservation of horticulture, manufacturing of semiconductor, gallium arsenate substrate production and wafer processing, cleaning and maintenance of iron implant machine, handling of iron source, manufacturing of alloy with copper and lead and glass, smelting of arsenical, especially non-ferrous ore, dust generated during grinding, screening, transfer and maintenance work on furnaces, fuels and filters, manufacture and use of arsenic compound, pigment manufacture and use of anti-fouling agent paints, and arsenic waste disposal. So look at it, the same thing. Arsenic is present in a lot of industry, is present in a lot of processes, same like what we discussed just now on lead. So the idea, the thing is, make sure that when you are exposed to, so the main use of arsenic is more as a pesticide, and also is present as in other, when you are producing other handling other metals or other chemicals. All right. It is present as a byproduct when you are doing other or manufacturing or producing other metals or chemicals. What's the health effect of arsenic? Acute effect: abdominal pain, diarrhea, seizure, shock and coma. Chronic effect consists of vascular disorder like Raynaud's phenomena, peripheral gangrene. Raynaud's phenomena because it affects the blood vessel, and Raynaud's phenomena means that you feel cold and your hand become red, and blood basically does not flow to your hand, and from red it become pale. So that's what is called Raynaud's phenomena. And for prolonged time of exposure of this decreased blood flow into your peripheral vessels will cause gangrene, and this is where we get peripheral gangrene. Peripheral gangrene means that your digit or your fingers or your toe actually become black and die off because of the decrease in blood flow. Of course, we know that if you smoke, also you can get peripheral gangrene. Of course, that is the effect of some of these chemicals. So other chronic exposure, you get dermatological disorder. So what you get is non-malignant follicular eczematous dermatitis due to local irritation, and also can become malignant. Malignant basically is cancer, dermatological or skin cancer. So you can cause skin cancer. Other chronic effect includes peripheral neuropathy. Neuropathy means that your nerve is affected, so it is more affected in your motor nerve compared to sensory nerve, and it's more affected in your lower limb compared to upper limb. Carcinogenic effect, it causes lung cancer, angiosarcoma, cancer of the blood vessels, cancer of the skin. Just now we discussed about the dermatological effect or skin cancer. Teratogenic effect is basically affect the baby or affect the fetus. So it causes fetal toxicity. It means it's toxic to the fetus, or fetus is baby before it's born, and it can also lead to congenital malformation because of the exposure to arsenic during conception or before you are born. Arsenic gas causes hemolysis, basically breakdown of red blood cell, and also abdominal pain, hematuria, it means blood in the urine, jaundice because of breakdown of the blood. So when you break down of blood, then you become jaundice or yellow discoloration of the conjunctiva. So because of the breakdown of the blood. Secondary, you get multiple organ failure like acute renal failure because of the hemolysis, because of too much blood, and liver failure, and also leads to cerebral edema of the brain, and it leads to delirium, coma, and the delirium means you are not, you basically delirium and then coma, and leads to your death. So this is just an example, a case of when arsenic, a lot of chemicals are present naturally in the environment. All right. So when you want to extract certain food or certain liquid, certain water, sometimes when you're extracting it, the chemicals are, you're extracting it along with the chemicals. So in many countries, there is a lot of arsenic in the groundwater. So for them to, so when you're extracting groundwater, it's important that you analyze the water to see whether there is any other heavy metals or arsenic poisoning. We are lucky in Malaysia, we don't have much arsenic in our soil, but in Bangladesh and also in Indochina, there are a lot of arsenic in the groundwater. So how do you, what is the method for you to remove arsenic from groundwater? Anyone? So tube well is basically groundwater. When you drill a hole into the ground and you extract the water, so you basically, it's called tube well. So usually tube well is associated with a deep well. All right, deep well is different from shallow well. Deep well is, the problem with deep well is basically it's more affected by your chemicals or your metals or in the ground, and shallow well is more related to affected by pollutant from the topsoil, where actually you can seep into the water in your shallow well. But for deep well, it's not affected by surface pollution. It's more affected by the geological formation. Anyone know how to remove arsenic from water? What is the method that they are using, especially in Bangladesh or in Indochina? Indochina is basically consists of Vietnam, Cambodia, Laos, and and Thailand. Anyone can discuss on this arsenic? How do you remove?
Hi, doctor. It's usually from using coagulation process, right?
Sorry?
By coagulation process.
Coagulation. What do you mean by coagulation?
You can add I guess like alum doses.
Alum.
Yeah.
No, alum is more for when you treat water, you add alum is to remove smaller contaminant, not the heavy metal.
So heavy metal.
Sorry. Yes. Ananda?
So what you mean is you mean like the before you can go into that treatment process. How do you remove arsenic before that process itself?
You can remove arsenic after that. But
okay.
These are ground more of groundwater. So alum is added is more towards when you use surface water.
Treated water. Okay. Got it.
You want to remove all the other pollutant that the big pollutant to basically to to coagulate it so that it becomes heavy and then it settles down on the onto the bottom because of the alum formation. But for arsenic, you use a specific. There's another method of basically you can remove arsenic. So these are more heavy metals. So heavy metal is quite difficult. It's much more difficult to remove than just a normal pollutant in your solid pollutant, bigger pollutant. So what is anyone have any idea? Ananda, you are environmental engineer, is it?
I'm chemical engineer, but I work in the environmental industry.
Chemical engineer. So basically, they have tried to use iron as to react with the arsenic, all right, and that basically by iron reacting with arsenic, you can remove the iron arsenic compound, and then the water can be safely consumed. So there are a lot of people that use that kind of technology cheap technology to remove to allow them to drink water.
Is there any other effluent when you mix iron with the arsenic?
Not really, because iron is not a problem, because if you drink iron, you know that if you iron is a compound that is necessary for the body, correct?
Yep.
Because it is used as for the synthesis of heme or hemoglobin. Hemoglobin is part of your red blood cell. Is part of the is used to transport oxygen. Correct.
Correct.
So if you go to India, if you cook in iron pot, all right, the iron pot actually can leach out into the food, and if you consume that, you're consuming iron. So it's good actually. So when you mix iron with arsenic, so extra iron basically will go into the water, and just that the water would taste metallic, but it would not be harmful in that context. So also you can arsenic and iron compound. Of course, there's other method of removing arsenic from basically by membrane filter, correct? Since Ananda, you are a chemical engineer, you know that membrane filter actually can remove a lot of contaminant. But the problem of a membrane filter is quite expensive. So it's not easy to use in low technology circumstances. So people have used basically iron to remove arsenic from the water. You look at the problem in Bangladesh is that a lot of the groundwater basically are polluted by arsenic. Not to say polluted by arsenic, contain arsenic. So these are sometimes the problem is when it's naturally occurring. That's where you have the problem of there is a lot of arsenic. Heavy metal or other metals. That's why when you're extracting water, especially groundwater, it's important for you to ensure that the heavy metal contaminant in the groundwater are addressed, and those heavy metal that can cause harm that are removed. Right. Thank you, Anand, for sharing your experience. So these are some of the effect of when you have arsenic. So basically, it's called arsenosis in patients in South Bangladesh. So you look at it, they're exposed to arsenic, and they have all these adverse of arsenic poisoning, nodular keratosis in their hands and in their foot. All right. Okay, are you okay? Clear? So are you happy with arsenic and lead? So we have went through two, arsenic and lead.
Sorry, Prof. Just a small query. So we are learning now on the heavy metals, such as mercury, arsenic, and lead. But we are learning mainly the effects on humans, right? We are not learning on the effects on the environment and so forth.
No, we are learning the occupational and environmental effect on human.
Only on human. Okay, thanks.
We are not learning. We are not looking at what are the effect on environmental pollution.
Yeah. Okay.
So even if you do environmental impact assessment, all right. And the biggest component that on environment impact assessment is still the effect of the impact to human health, and not just the impact to the environment, but the impact of development to human health. So they still go back to on the human environment.
But usually it's through the leaching of groundwater or soil and all. Do that from that it will directly affect the human, right?
Yes. So the leaching actually would affect human. The leaching, the idea is that when you talk about environmental, when anything that affects human, you consider environmental. So the idea is that if the pollution affect your domestic animal or your other animal or your plant, is also considered part of human exposure. It's just that it's not direct, but still indirect, but still considered human exposure. So it's still considered as the human exposure, human to health. So when you talk about environmental itself, you talk about other thing that is not related to human. It is actually a very small amount that's not related to human. So most of it is you come back to you if you pollute the environment, you come back to us in the long run. So when we talk about when we discuss just now, it's basically on lead and on the arsenic, but we are the only discussing the human reaction to exposure to lead and arsenic. So it's important that although you are basically not looking at health per se, but understanding how this chemical affect health is important, and it's easier for you to, when you want to communicate or want to discuss or want to understand this with other group of people. Okay, Ananda, are you okay?
Yes, got it. Thank you, doctor.
No problem. All right. So arsenic is basically used extensively in industry also. All right. So anyone of you from semiconductor industry here? Anyone? So arsenic is used as arsen gas in semiconductor industry, and arsen gas is basically hemolytic. So usually the process is closed process. No one will get exposed to arsen gas because it's a very dangerous process. So it's only in an emergency situation you are exposed to arsen gas itself. So no one is actually exposed to arsen gas. So when you talk about exposure to gas, exposure to any what we call disaster or emergency situation release, emergency release of any gas, it's important for you to understand where do you go when there's exposure to gas. All right, let us, since we're discussing something on that, let us look at chlorine. All right, where do you use chlorine? What's chlorine?
Chlorine is a chemical that eliminates microorganisms.
Anyone?
In water treatment process, it's one of the most important chemical dosing.
Yeah. So in water, what you say just now, Ananda?
In the water treatment plant.
Okay, in water treatment plant, what type of chlorine do they use?
You mean in what form? Like powder form?
Yes,
is it?
in what form? Sorry, yes, in what form? In the more. What's the form of chlorine?
It comes in powder form first, right?
No, powder form is not used. You can't use powder form in a water treatment plant.
Okay,
You basically you would be, if you are the environmental engineer there, whole day you got nothing to do, but just to mix the powder with the water to make sure that your dosing is correct. So no, don't use powder form in water treatment plant because they use a lot of chlorine.
Okay, go ahead. Sorry.
Have anyone worked in a water treatment plant before, or have anyone visited a water treatment plant before? So they either use gas or most of the time they use gaseous or liquid chlorine. All right. So chlorine comes in a compressed container form, so liquid form. So the property of of course, chlorine we know it causes acute toxicity, and it is an irritant, and it basically it will affect it will kill you straight away if you're exposed to chlorine gas at that amount. All right. Of course, we know that if we mix bleach, correct, with vinegar, we get chlorine gas also, correct? Anyone know that? That's why you cannot mix. You can when you're using cleaning chemicals in your house, you cannot mix the cleaning chemical, because some of the cleaning chemical contains chemicals that can react to the bleach that can release chlorine gas. So chlorine gas is actually a very toxic gas, and it's an irritant, and your lungs will basically become inflamed straight away. So the idea is chlorine gas, the property of chlorine is it heavier than air, lighter than air? What is the physical chemical property of chlorine? So chlorine gas is usually is heavier than air. All right. So when it's heavier than air, that means you have to go to a higher ground when there is a release of chlorine in the environment. So it will settle down in a valley. So usually when you talk about chlorine storage in a water treatment plant, it's usually in a lower level compared to where your main office is, or where your center is. So the idea is that you need to understand, when you talk about emergency or release, or that you need to understand what are the property of the gas release, and where should you place all your what we call main process. Okay. Now we move on to mercury. All right. Mercury, of course, everyone knows is quicksilver. All right, because it is basically the only metal that's liquid in NTP, normal temperature and pressure. So mercury is elemental mercury. It's silver white in color, of a quicksilver, heavy, liquid at room temperature, and it actually become, because it released fumes released from the mercury because of the liquid. So inorganic mercury found in nature is mercury sulfate, mercury nitrate. Organic mercury is methyl mercury and ethyl mercury. So mercury is associated with a lot of issues when we talk about environmental exposure to mercury. So mercury itself, of course, there are occupational risks to exposure to mercury. Mercury is used in some type of manufacturing, especially when you talk about when you want to do extraction of metals, or especially gold. They used to use when you are dealing with artisan gold, basically extraction of gold from in a previous kind of traditional kind of way. You use mercury as one of the way of extracting gold, because when you boil mercury, when you smelt mercury along with the gold and the impurities, mercury will absorb all the impurities, and then you get basically pure gold out of that. And that is where the risk of mercury poisoning comes, and that is where you need to focus on. So sometimes when you hear of some findings of gold in certain village area, or certain people found gold, the first thing you have to be careful is that there would be mercury poisoning in those villages because of effect of mercury, and gold is one of the mercury actually used in gold smelting, especially when you talk about artisan gold or traditional way of smelting. All right. So those are basically, most of the time they use methyl or ethyl, elemental mercury, and they mix it together. Of course, mercury also found in your teeth, correct? So the main thing is the thing you must understand, or must always remember, is when it is bound, there is no problem, but when there is a start to leach, then you become problem. Of course, mercury will leach from your teeth in a long period of time, so it become a problem. All right. So inorganic mercury you can find in smelting, treatment of gold and silver ore. So as I said earlier, so inorganic including elemental. So when you use smelting or silver or gold ore, you use mercury as one of the product that you use. Of course, currently you use cyanide. Also, cyanide is also one of the product that you use for smelting of gold. All right. So manufacture amalgam, dental and jewelry. So now currently we don't use mercury as a dental for denture. That's what you see in this picture. We don't use anymore. What we use is basically more of a synthetic product. But the problem is the synthetic product that we use is less durable than the mercury. So that's why sometimes you need to, when you got filling, you need to fill it again around 20 years or 10 years later. You could fill it again because of the you cannot last so long. So previously, dental technician used to develop or form this amalgam within the laboratory, all right, or mix this amalgam within the laboratory. That's why it's exposed to mercury as a dental technician. It used to be present in bulb, correct, and also mercury bulb and mercury batteries and X-ray tubes. So those are where you can still find mercury. The other way you find mercury is elemental mercury. You get it in your thermometer and also your BP set. So in hospital, basically especially in University Malaya Medical Center or University Hospital, we are trying to phase out all mercury, and we are converting all our temperature thermometer and also the BP set using electronic, because currently electronic, the sensitivity and the sensitivity is good enough for us to use electronic thermometer and electronic BP set. So when you're exposed to mercury, mercury affect your respiratory system and also affect your digestive system. So you get what we call chemical pneumonitis, basically inflammation of lung tissue due to chemical exposure, edema of the lung tissue. So because of the acute exposure to mercury, where mercury is the toxic agent and it is an irritant, and it can cause chemical pneumonitis and edema of the lung tissue. When you are ingesting mercury, you get in the digestive system, you get gingivitis, inflammation of the gum, increased salivation, stomatitis, inflammation of mucous lining of the mouth, bruise line at the tooth edge of the gum, inflammation of the intestine, and causes diarrhea. So the inflammation the inflammation is internal, and externally you will get symptom. You get diarrhea as a symptom. Other effect, acute effect, it can also affect the kidney. Acute nephritis, as I say, nephropathy. So because acute nephropathy or acute nephritis, inflammation of the nephron, and it leads to renal failure. Renal failure is kidney failure. And of course, central nervous system, it can cause tremors, sensory peripheral neuropathy, neurobehavioral changes. So the effect is something similar to lead exposure, but this is much more higher because of the nature of the mercury is more volatile compared to lead. Chronic, mainly nervous system, CNS as above, acute symptom, GIT, gastric, gastrointestinal, salivation, gingivitis, inflammation of the gum, the erosion of the teeth, blue line on the gums. So these are some of the blue line of the gum is just a sign that we can see, then we can diagnose it as a mercury poisoning. So more of chronic of a central nervous system is tremors and other kind of encephalopathy, that is inflammation of the brain. Long-term exposure, you get renal, of course you get renal polyproteinuria, nephrotic syndrome, and leads to renal failure. reproductive health, decrease in sperm formation, increase abortion. So mercury also leads to decrease in sperm formation. This one was inorganic mercury. Organic mercury is an irritant. It causes skin dermatitis, perforation of the nasal septum. Nasal septum is the septum between the two nostrils. This is nostril 1, nostril 2. The between the nose, it's called septum. So there's perforation of the nasal septum. It causes chemical burns and also ulceration. Basically, it's some sort like it can cause burns. That's why it causes the chemical ulceration. Also, long-term exposure to organic mercury. Basically, this is from when you consume fish or seafood that contains mercury. You get headache, fatigue, poor memory, poor concentration, paresthesia. Paresthesia is basically decrease in sensation, like tingling, tingling, burning, pricking, and numbness. So you get all this funny sensation in your most of the time in your hand and your feet, right? Tremors when your muscles become involuntary movement, ataxia, lack of voluntary coordination of muscle movement, and dysarthria where because of the affecting the central nervous or peripheral nervous system, you are unable to talk properly because of the affecting the peripheral nervous system. So Minamata. So anyone knows what is Minamata disease? Why we call it Minamata disease?
It was some disaster in Japan, right? From
Yes.
the heavy metals in the water.
Sorry?
Due to some heavy metals in the water, is it?
Mercury.
Okay, yeah.
All right. Anyone? Basically, Minamata is a province or in Japan. All right, and there is Minamata Bay. So one of the factory actually was discharging mercury into the water around the bay. So when mercury is discharged, inorganic mercury discharged, and is consumed by the fish, and the fish actually the plankton consumed by the smaller fish, consumed by bigger fish. When it converted, then it become converted to organic mercury. When it enters the body of the people actually consuming the seafood around the area, that's where your chronic effect of mercury came into place. So you got headache, fatigue, poor memory, poor concentration, paresthesia, tremors, ataxia, and dysarthria. So if you look at it, basically all these things affect both your central nervous system and your peripheral nervous system, and it affect the developmental of your brain. Also, it affect the amount of volume in your brain. Okay, so chronic exposure, you can also get visual disturbance, hearing disturbance, deterioration of personality and intellect, exposure to in utero, especially in utero means exposure inside when you're in a baby. During pregnancy, you get cerebral palsy. So cerebral palsy means that your brain does not develop properly, or due to the exposure to mercury, and that's where you will get a lot of problem after post-birth. So you can get cerebral palsy also from decreased oxygen during your birth, during the delivery, where there's a decrease in oxygen level to the baby. You can get cerebral palsy also because of the brain development issue. But this also basically will be affected. You are exposed to mercury. So occupational exposure to mercury, where you can get it: mining, gold and silver mining. As I mentioned earlier, gold and silver mining, when we're talking about use mercury, you don't find mercury. More of it use mercury as for your smelting to remove the impurities in the gold and silver. Dental assistant, as I say, dental technician, when they use mercury to basically they mix the amalgam to form the amalgam, and the amalgam contains mercury. But currently there's no more mercury in amalgam anymore, so they don't use mercury anymore. So there's no problem with that. Felting process of head manufacturing, as we discussed last class, where we talk about the top hat, we talk about the Mad Hatter. So basically, they use that to remove as a pesticide or insecticide or fungicide to basically prevent fungal formation on the top end. This is called felting of process in hat manufacturing. Environmental exposure, as I discussed earlier, one of it is Minamata disease. Minamata disease is where the company actually dispose of mercury into the water and then is converted from inorganic to organic mercury by the fish and also plankton, also and then it was consumed by the human, and then that's why they developed the issue or the symptom and sign of Minamata disease, of chronic mercury exposure. The other problem of mercury is basically when we talk about seed dressing. Anyone know what is seed dressing? Why do you use mercury in seed dressing? Are you following me or not?
Yes.
Yes, bro.
Okay, what is seed dressing?
Maybe for to make sure the seed do not any pesticide to the seed when you plant the seed, so that make sure the seed do not contact with pesticide or something like that.
All right. Okay, something like that. So basically, seed dressing means that you put some chemicals, some pesticide onto the seed, so that the seed itself is not affected by any fungal or any bacteria. All right. So it is protected from being affected by or being contaminated or being by bacteria or fungal. So you dress the seed with mercury, and if this seed is grown and come out as a what we call that, basically most of the time the seed that they're talking about is wheat. All right, so wheat actually that's why it's important for you to look at whether the wheat is actually used as a seed or the wheat is used as a food. So the seed, the wheat actually can be used as to consume. You can consume wheat straight away. But also you can use it as a seed, which is the wheat seed, to actually plant wheat, and then you wait for it to grow, and then it basically become food. All right. So the problem with seed dressing is that previously there's a lot of people do seed dressing, and I think currently there's still. Basically what they do is they dress the seed with mercury or any other pesticide, and then for it to be so that it can last longer and it doesn't get affected by biological substances like fungus or bacteria. So the problem with this is that when you give it to people who is hungry and ask them to grow the food, they don't grow the food, and that's where you get mercury poisoning. All right. So seed dressing. So several large incidents of poisoning have occurred in Iraq, Pakistan, Guatemala due to ingestion of flour or wheat seed treated with methyl or ethyl mercury. Iraq, over 300 people were poisoned after eating seed treated with fungicide, ethyl mercury, P-toluidine, sulfonylate in 1956 and 1960. In 1963, 1964, and 1965, Guatemala reported similar poisoning from mercury fungicide that was found in wheat seed. Victims died at the rate of 44%. 1969, similar outbreak in Pakistan. Iraq again in 1971, 1972. Bread prepared from seed grains treated with methyl mercury caused an outbreak of poisoning. Thousands of people were affected and several hundred died. Grain is treated before planting to guard against disease of the seed. So the thing is, the reason for seed dressing is for it to protect against diseases, especially fungus, so that you can plant it and then you can grow more wheat, and that is basically what is used, what the seed dressing is for. But when you get seed to hungry people, and then people, of course, will take the seed to feed themselves first before they actually take the seed to grow. So it's important. It is important you understand when you give something to some people, you need to know that what are the reasons. So seed dressing is the thing that is important, and you must understand that. So when you are doing anything, you need to understand the consequence of doing something. So Minamata disease, all right. So Minamata Bay is basically in Japan. Minamata disease is an encephalopathy, basically inflammation of the brain, and also peripheral neuropathy, where your peripheral nervous system get affected. What happens is caused by daily intake of fish, and shellfish contain methyl mercury. So we know methyl mercury is basically a organic form of the mercury. Minamata disease broke out in Yasushiro Sea coastal area, particularly around Minamata Bay in Kumatomo Prefecture. Later, it occurred in Agono River Basin in Niigata Prefecture. So it is somewhere in Minamata Bay. So you can see the So it's basically the factory that's really discharging mercury into the sea, right? So from 1932 to 1968, the Shiso factory in Japan dumped estimated of 200 to 600 tons of mercury compounds into the Minamata Bay. In the Minamata Bay area, an outbreak of Minamata disease was reported in 1956. At the end of the year, the number of identified patients reached 52, of which 17 had already died. In 1957, this unknown disease was named Minamata disease. In the Agano River Basin, the first reported Minamata disease patient found in May 1975. By July 1965, a total of 26 patients were recognized, of which 5 had already died. So what happened is that the chemical released from the factory, Shimo's factory, is basically methyl mercury and plankton cause, and then it basically consumed by fish. All right. So basically, what is the inorganic mercury is converted organic mercury, and then is consumed by humans. So elemental mercury is biotransformed by bacteria into methyl mercury, and then bacteria are eaten by molecular Cretaceous and concentrated up the food chain. So methyl mercury is distributed evenly through the fish and is not changed throughout cooking. So that is the problem of basically mercury does not degrade. We know the elements does not degrade with cooking. You cannot remove elements, correct? So basically, what's the character signs of Minamata disease is gait disturbance, loss of balance, which is called ataxia, speech disturbance, dysarthria, constriction of visual field. Basically, your field of vision becomes smaller and smaller, so you can only see a pinhole. Stereoatrasia. Basically, you will not able to look at both binocular vision or binocular. Muscle weakness, muscle cramp, hearing disturbance in sense of pain, touch, and temperature. So basically, it leads to disturbance of sensation. So it looks like this, that these are the area of the brain affected. It's the red color area of the brain affected, where basically the brain degrade, and the function of that part is basically affected because of the mercury formation. This shows that the 51-year-old male, cerebral, weight 1,380 kilo, case of acute onset, long-term survivor, 23 years old male, female brain. So there's one, this is the female brain, this is the male brain. So horizontal section of right hemisphere of cerebellum. So you look at the decrease in the gray and the white matter. Gray matter, decrease in the gray matter. So this is the gray matter, this is the white matter. Okay, are you okay? All right, so we have finished basically looking at lead, arsenic, and mercury. So we're left with cadmium and nickel as metal or metalloids. All right. So cadmium, what is cadmium? Cadmium is a rare mineral found in zinc, lead, copper ores. So when you get exposure, electroplating or welding, most common exposure, electroplating is a corrosive resistance, welding cadmium coated electrodes and solders, welding of materials coated with cadmium, smelting and refining of zinc, lead and copper. So the idea that you need to remember is that although in Malaysia we think that we don't have much minerals, but there are some minerals still in Malaysia. All right, we have gold actually. We have gold in Kelantan. We have also some ores in Pahang, like your bauxite. So, but of course, most of the time we don't process those ores here in place. We basically send out other overseas or through other processing plant elsewhere. But for gold, actually, we do process gold here in Malaysia. So the idea is that when you mine anything, there is no you don't get the pure product. So there is always a contaminant. So sometimes the contaminant is there. Sometimes the contaminant is also valuable. So the idea is that there is no pure metals or things like that. So there's usually some contaminant, and that is where you must be careful when you are looking at when you're talking about mining or foundry. So nickel is basically a useful metal. It's used for nickel cadmium. All right, so nickel cadmium, we used to use nickel cadmium, but now we use more of lithium ion than nickel cadmium. Nickel cadmium is nickel battery. All right, used in paint, also used in PVC, polyvinyl chloride, so one of the additive in PVC, fluorescent lamp, and semiconductors industry. Cadmium alloy is high-speed bearings and solder and jewelries, and also it's used as cadmium in phosphate and as a fertilizer. Health effect of cadmium, acute health effect. So respiratory system, it causes chemical pneumonitis, irritation, metallic taste. So basically it's more of an irritant, and that's where you get chemical pneumonitis. So when a chemical is an irritant, you basically you get the inflammation of the lungs, and because then it becomes a pneumonitis or lung inflammation, and then you get lung edema. So the gastrointestinal tract, so you get abdominal colic and diarrhea. Also, this is due to inflammation itself, and that's where you get abdominal colic and diarrhea because of the inflammation. Acute renal failure, when it absorbs into the body, you can get acute renal failure, where proximal tubules basically your nephron, and you get sugar in the urine, you get amino acid in the urine. So basically, you get protein and sugar in the urine. That's where you get renal damage and lead to renal failure. Usually, you don't find sugar in the urine. You don't find protein in the urine. So your urine usually don't have sugar or protein. Once your urine have sugar and protein, that means there's something wrong, and your kidney has actually been damaged. So there's what the chemicals actually can damage your kidney. So sometimes, of course, you also can get protein and sugar in your urine if you are diabetic, and also if you basically have some infection, and the infection actually can cause the protein in urine, but normally you don't get it. So this is proximal tubules damage, and you get glycosuria or sugar urine, and also amino acid in urine, which is basically protein in urine. So chronic, you get renal function, renal kidney failure, proximal tubule damage, proteinuria, and nephrotoxicity. So your nephron become affected. So basically, your renal fails, and the nephron is the main part of the renal, as it's actually responsible for producing urine. And you get itai disease, kidney damage, calcium hemostasis disturbance, proteinuria, renal osteodystrophy, and osteomalacia, or you get bone pain. So you get this is not because of kidney. Itai disease get kidney damage, but also you get bone pain. So itai in Japanese is basically synonym with ouch. So it's actually your bone is actually very painful. That's why they call it itai. It's also another Japanese disease due to the exposure in the early stage of their development, where there's a lot of occupational and also sometimes environmental exposure. So emphysema is basically your difficulty in breathing, and the damage to your alveoli, of your lungs. You leads to emphysema. And lung cancer is basically IARC 1. So cadmium is IARC 1. So as we discussed just now, IARC 1 means is this carcinogenic to human and cause liver dysfunction, anemia, and osteoporosis. Osteoporosis, basically the bone become the minerals in the bone is reduced. That's why you get osteoporosis. Nickel is another metal. Nickel is basically gray, white, silver, refined to Mond process, treated with carbon monoxide to form nickel carbonyl. Widely used as stainless steel, nickel, chromium, ferrous iron alloy, nickel, copper alloy in food processing, machinery and dairy equipment, nickel aluminum alloy used to magnet and catalyst production, nickel chromium alloys used for heating elements like gas turbines and jet engines. So nickel is basically used in a lot of industry, right? Of course, nickel is a very cheap metal, all right? And when is just exposure? So it's very simple. Usually exposure is when you are mining, roasting, smelting, sintering, or refining the ore. So in the Mond process, the workers are also exposed to highly toxic nickel carbonyl gas. Production of stainless steel or nickel alloy, also you are exposed to nickel. Welding of stainless steel and nickel alloy, remember we talk about fume generation. So if you are welding any metals and you are heating any metals, you will get the fume of the metal. So if you're welding stainless steel or nickel alloy, then you basically are getting the exposure to the nickel from the fume, nickel fume. Nickel cadmium batteries, computer components, electroplating, corrosion resistance, or decorative finish. Non-occupational exposure is basically contaminated in cigarette smoke. Of course, we know that cigarette smoke, arsenic also is found in cigarette smoke. All right, nickel also is found in cigarette smoke. So there's a lot of chemicals that are not, there are heavy metals that are also found in cigarette smoke. So when you smoke cigarette, you get not just exposed to just the normal carcinogenic of the cigarette, but also you're exposed to a lot of heavy metals from the cigarette smoke. That's why arsenic just now you can get peripheral decrease in blood, and then you get gangrene formation. But nickel you get skin allergic contact dermatitis. So it's very common. Allergic contact dermatitis among nickel is common because nickel is allergen and people can get allergic to the exposed to nickel. So a lot of people are allergic to nickel. Respiratory symptom, you get rhinitis, sinusitis. All right. Basically, rhinitis is the running nose. Sinusitis is sinus problem. Anosmia is difficult. You cannot smell properly. Perforation of nasal septum, same like what you find in chromium. All right, and also cadmium. And the next is pneumonitis. Of course, the inflammation of your lungs, you get pneumonitis. So remember what's anosmia? Of course, anosmia you can get in a lot of respiratory illnesses, like even you're exposed to COVID-19 pandemic, COVID-19 or SARS-CoV-2, you can get anosmia. Anosmia is loss of smell. Chronic, you can get nasal and lung carcinogen. So nickel is actually considered an IARC 1, which is carcinogen to human, and also can cause larynx carcinogen. Larynx is your voice box where you get the laryngeal carcinoma. So what you see here is basically exposure to nickel. This is contact dermatitis due to exposure to nickel. This lady is actually either she's wearing this too is costume jewelry. So actually, if you costume jewelry, you can basically expose to is considered nickel. What's costume jewelry? Costume jewelry, most of the time jewelry, unless it's gold or silver. Gold and silver, there's no problem. But if it's a cheap jewelry, it is made from nickel. Nickel and this and that is a lot of nickel in this type of jewelry. It looks very shiny, but because for me to look shiny and cheap, you just put nickel instead of gold and silver. So it's costume jewelry that you get this type of problem. Another problem you get from this is basically if you look at if this person is basically working in a semiconductor industry, sometimes people use of what we call the band around the anti-static band. If you're working in a semiconductor industry, you're doing a lot of electronic work, you need to put a anti-static band to remove the static electricity, because static electricity can spoil the circuit board, and because some of those anti-static band are made of nickel, because it's the cheapest metal. That's why you can if you see this type of cases, you see there are people with a lot of what we call contact dermatitis or lesion around the hand, and this most probably due to their anti-static band, and you can actually improve that by changing the nickel to another conductor with either copper or conductor, but copper of course is much more expensive compared to nickel. That's why they use nickel as an anti-static band, but you can use other conductor as an anti-static band to remove the static electricity when you are handling what you call electronic products. So we have finished with the metal and metalloids with lead, arsenic, mercury, cadmium, and nickel. But this is not everything that's present, but this is some of the metal and metalloids that are commonly found in the industry. And the idea is that why are we discussing only this limited amount of metalloids, is that to have a broad idea of what are the exposure is, and how it basically affect the when you're exposed to metal, and what is the health effect of these metal and metalloids, and what can you do to actually prevent exposure to metal and metalloids. So if you look at it, there's not just an occupational exposure, we also have environmental exposure. Environmental exposure not just from what we call human activity, but also from natural exposure. You can expose to metalloids and other kind of hazard in the environment because of natural exposure, because of where you stay, and because of the geological makeup of the soil where you stay. So it's important for you to understand also when you're depends on where you're going to work next time. If you're going to work in Malaysia, there shouldn't be a problem. But when you're going to work elsewhere in a different country, in a developing country, where there is a lot of things that you need to focus on. So all these things are part of the responsibility of a safety and health, not just on the occupational. Sometimes you need to focus on the environmental effect for the workers. Also, you look at the workplace itself. So the idea of work only focus in the workplace and not beyond the workplace is going to be the thing of the past. If you look at what is happening now with the COVID-19 pandemic, if you don't take care of your workers outside the workplace, you will get you. If no question, then we move on to the second part of our discussion today, which is focus on other chemicals in the workplace. All right. And again, as I mentioned, I want to emphasize, this is not the full list of chemicals that we are looking at in the workplace. It's just a summary or a pick of important chemicals or important discussion. So the idea is that at the end of the day, at the end, what you need to do, you need to be able to read and understand what we call information available to you on the chemicals in the workplace, and how do you approach and how do you consider what are the preventive or measures that you can take. Main type of chemicals in the workplace is basically most of the time is solvent or pesticide. Of course, there are other kind of chemicals in the workplace that you use to manufacture different kind of product or chemical that included in a product. But the problem with solvent is what we are concerned about because of the volatile nature of the chemical. So solvent is basically any chemical used to dissolve substance is called a solvent. It can be basically to dissolve a substance in the process of cleaning a substance. It's called, you can use solvent to clean a substance. Also, you can use solvent to basically as part of your chemical process to basically produce a new product also can call it solvent. So pesticide is any chemicals used for to kill pests. All right, so pests can be any kind of a pest, from bacteria, viruses, fungus, up to your rodent or your, that's why we call rodenticide. So depends on the different kind of chemical pests that you want to control, you use pesticide. So solvent is what we're going to discuss. So solvent, what is solvent? Solvent are substance, usually a liquid form, that dissolve another substance, resulting in uniform dispersal of mixture. Most industrial solvents are organic in nature and are commonly used for cleaning, degreasing, thinning, and also extraction. So sometimes people use solvent to extract other chemicals from the chemical you dissolve. Basically, what you want to do is to dissolve the chemical in a uniform mixture, and that is where so the problem, the main problem is not in when you're using solvent as in the process itself, because usually the process are closed, but it's more a problem when you use solvent for other non-industrial process, like your cleaning, your degreasing, your when you're trying to do major shutdown where you clean the whole plant. So that become a problem. So when we talk about solvent, we can talk about either allopathic or aromatic or aliphatic. So can be chlorinated solvent, trichloroethane, methylchloroethane, aliphatic hydrocarbon, and hexane, or aromatic hydrocarbon like your benzene and your toluene. So it can be chlorinated, aliphatic, and aromatic. Aliphatic is straight chain. Aromatic is basically your benzene kind of ring. So it's a ring chain chemical. So aldehyde, you get formaldehyde, glutaraldehyde, alcohols. So formaldehyde, glutaraldehyde is a solvent, but also is basically aldehyde is used for a disinfectant, all right. And formaldehyde and glutaraldehyde is used as a disinfectant in a lot of, especially in healthcare industry. So glutaraldehyde is used in what we call cold disinfection, or basically used to disinfect equipment for use in more in colonoscopy or gastroscopy kind of scope. So to disinfect scopes. Alcohol, methanol, ethanol, ketones like your methyl ethyl ketone, methyl isobutyl ketone, and also methyl N-butyl ketone. So these are some of the chemicals available. So absorption, toxicokinetic of the chemical, most probably is inhalation. It's fat soluble because then it can come through skin. Factors affecting absorption, concentration in inspired air, partial coefficient of the chemicals in the blood, air-blood partial coefficient, or blood tissue partial coefficient, how fast you're breathing, what you're breathing. We look at pulmonary ventilation or blood flow. So this is basically depends on the activity, what type of activity you're doing, whether you are sitting in office or whether you are working in the field or working in the factory floor. So this is a different type of activity, although you're exposed to the same chemical, but the cardiac activity, your pulmonary activity is also important. It means your respiratory rate and your cardiac output. Your respiratory rate and your heart rate is important to look at the absorption itself. Body fat is more for how much chemicals actually stores in the fat. So the chemical will be released slowly in the fat, and also depends on what type of work practices, like we discussed that day. How do you work, whether you wash your hand or not. So those are things you need to look into and need to focus on when you look at the exposure of the workers. So distribution is lipophilic, metabolism is by the liver, excretion is by alkyl unchanged compound, metabolites in urine. Clinical effect, skin, dermatitis, because of the defecting property we mentioned earlier. Basically, the skin is defect, it removes the subcutaneous fat, and that's where your skin become less fat, and that will cause you to have dermatitis. Dissolution of lipid from the skin, CNS, you get depression, chronic who is Win, chronic, acute, you get depression, chronic, you get solvent neurotoxicity, peripheral nervous system, like your sensory motor neuropathy. That means you get decrease in sensation, your motor function will decrease, you get wrist drop, or you get a foot drop, and sometimes you get muscle, where your muscle become, because of the effect, the muscle will degrade, and then there'll be loss of muscle mass. Respiratory system, upper respiratory airway irritation, we need relation to pneumonitis and pulmonary edema because of the irritation of the chemicals. Chemical irritate and they got pneumonitis, or then pneumonitis will lead to pulmonary edema. Cardiovascular system, cardiac sensitization, it can cause cardiac failure, hepatic liver disease, kidney, renal failure, renal tubular dysfunction, hemotoxicity, you can get anemia, leukemia. Anemia basically is decrease in red blood cell. Leukemia is the decrease on your white blood cell, or anything that do with white blood cell deformity or decrease, so we call leukemia. Anemia is basically decrease in red blood cell and decrease in the capacity of your red blood cell. And reproductive, we got teratogenicity. Teratogenicity affect the unborn baby, so we call teratogenicity. So if you look at it from the whole perspective, actually affect every organ in the body, and to a certain extent, and also it is because it affect each organ through the inhalation process. So now it's more specific, what kind of chemicals and what. Just now it was general process of chemicals in the workplace. So the idea is that all the chemicals almost cause a similar outcome or similar effect to the body, but depends on the severity or on the extent of the damage or that they cause to the body. So it depends on the chemical. So chlorinated hydrocarbon, basically hydrocarbon that contains chlorine, so it's used in cleaning and degreasing and thinning agent. Acute basic effect, it causes central nervous depression and respiratory tract irritation. So when we mentioned it, respiratory tract irritation will cause pneumonitis, or then it causes the edema, pulmonary edema. Chronic effect like dermatitis, the skin, solvent neurotoxicity, hepatocellular injury, methyl chloride, carbon tetrachloride. Anyone know where do you use carbon tetrachloride? Renal tubular dysfunction, also carbon tetrachloride. So carbon tetrachloride causes renal tubular dysfunction. Anyone know where you use carbon tetrachloride? Where do we use carbon tetrachloride? So carbon tetrachloride is basically a chemical agent used for dry cleaning. What is dry cleaning?
Laundry that washes.
Yeah, why you call it dry cleaning?
Because it does not use water, it uses chemical.
Yes, that's why I call it dry cleaning. So it does not use water, it uses chemicals. So one of the chemicals they use to dry clean is basically your carbon tetrachloride. So basically, what's the effect of water? Water is a solvent, correct? Water dissolve all the contaminants in your clothes, and then along with the soap, and basically it will just remove everything. But same thing you can use chemical to have the same effect. So that's why you call it dry cleaning. So dry cleaning doesn't damage your fabric so much as normal cleaning does. But the problem of dry cleaning is that you use chemicals, and those chemicals can have effect on the health of the person. So you must be careful when you are basically handling those chemicals. The main thing is that when you are handling those chemicals and the chemical is in a closed what you call that, closed area, then shouldn't be a problem. That means it's in a machine, and the carbon tetrachloride is basically introduced as a closed in a in a closed format, it's not a problem. Only problem is when the chemical escape. So the idea is that how do you prevent a chemical from escaping? So that's when the problem arises. So example, methyl chloroform, trichloroethylene, tetrachloroethylene, methylene chloride, carbon tetrachloride, trichloroethane. These are example of chlorinated hydrocarbon. So trichloroethylene causes decreases flush, sudden death due to ventricular fibrillation. So your heart doesn't suddenly just stop. Actually, fibrillation means your heart is pumping too fast, and because of the pumping too fast, it cannot pump any blood around your body. So basically, it causes ventricular fibrillation and lead to cardiac failure. Your heart actually fails, metabolized to trichloroethanol and trichloroacetic acid. So urine is inactive. To trichloroethylene, tetrachloroethylene liver enzyme can be used as an indicator for medical surveillance. Methylene chloride metabolized to carbon monoxide in the body. So we know what's the effect of carbon monoxide or not. Remember what's the effect of carbon monoxide? Anyone? We discussed it last week. What's the effect of carbon monoxide?
Reduces the oxygen content.
Sorry? So carbon monoxide has more affinity for your hemoglobin, so it binds to hemoglobin more readily compared to oxygen. Then you get basically hypoxia. So that's why the methylene chloride metabolized to carbon monoxide in the body. So actually, it would binds to hemoglobin have more affinity for hemoglobin compared to oxygen, and it binds more securely compared to oxygen. So that's the effect of carbon monoxide. So it causes hypoxia. Another issue with chemical is sometimes it causes Stevens-Johnson syndrome due to trichloroethylene. Basically, Stevens-Johnson syndrome can be due to chemicals or can be due to drugs, but sometimes chemicals can cause Stevens-Johnson syndrome. It's basically a rare and serious disorder of your skin and mucous membrane, usually a reaction to medication or an infection. Often it begins with flu-like symptoms followed by painful red, purplish rash and spread and blister. So basically, it actually can cause trichloroethylene. Some chemicals actually can cause Stevens-Johnson-like syndrome, which is very dangerous. So the idea is that these are more of reaction that we don't really call. We don't really have a dose-response relationship to it. It's just there, and it will basically you are worried that you get affected by it. The next one you look at is aromatic hydrocarbon. Aromatic hydrocarbon compounds that contains one or more benzene ring produced directly or indirectly from petrol or coal tar. Of course, we know that distillation of petrol, we get different kind of aromatic hydrocarbon, petrol distillation process. So benzene, the most basic form of hydrocarbon, effect of benzene, I think we have discussed it earlier, basically cause leukemia. Leukemia is it affects the white blood cell formation, so it causes leukemia. Aplastic anemia, where that means there is loss of red blood cell and also red blood cell and white blood cell. Leukemia is affect white blood cell, that's why I call leukemia, and aplastic anemia affect both red blood cell and white blood cell. Called aplastic anemia. Aplastic anemia, where there is decrease in both red blood cell and white blood cell in the body. Exposure level is, you look at ACGIH, is basically TLV. TWA is what? TLV is threshold limit value. The definition of threshold limit value is simple. It's just that value below which exposed for a very long time, you shouldn't see any effect. That means if you are exposed to 0.5 parts per million over 8 hours or 40-hour week for a long period of time, you shouldn't see any problem. So that's called TWA of 0.5 parts per million. Parts per million is basically how much the chemical is present in the environment. That's why it's called parts per million. All right. And TLV, STL is short-term exposure limit. TWA is time-weighted average. That means average of exposure over an 8-hour period. All right. But short-term exposure limit is basically exposure over a 15 minutes duration. So if it's more than 2.5 parts per million, then it considered is above the threshold limit value. That means it affects the body. It causes leukemia, aplastic anemia. So that's called aromatic hydrocarbon. So where can you find benzene? Anyone? Benzene. Benzene also is a carcinogen, all right? So benzene also is a carcinogen. Benzene can cause, is a carcinogen type 1. So leukemia actually is a carcinogen, all right? So carcinoma is a carcinoma of the white blood cell. It's called leukemia. Anyone?
Gasoline.
Gasoline, yes, gasoline contains benzene. All right. If you go to any petrol pump, it will sell that there is 5% of benzene in your gasoline itself, and one of the warning signs is that it can cause cancer. So gasoline actually cause cancer. So in some countries, especially in the Middle East, they don't call it gasoline. They don't call it petrol. They call it benzene. All right. That means that the petrol itself you can say is benzene, and then they will sell this is benzene. So so it depends on where you come from. If you come from America, you call it gasoline. You come from Europe, or you come from British, you call it petrol. But if you go to Middle East, they call it benzene. So benzene is basically the form. If you look at it, you look at the TLV and the STL, basically it's very, very what we call that, low, and you need to maintain a very low level. So to ensure that there's no effect on the health effect. So polyneuropathy due to petrobenzene. So benzene actually is used in what we call, it was used in degreasing. What do you mean by degreasing? As I mentioned last week, is that sometimes when you want to clean your engine, or you clean any parts that contains a lot of what we call that, a lot of chemicals, all right, or to remove stain, you mix it with you clean it with petrol, all right. So that is not recommended. That is not allowed. So benzene used for degreasing is not allowed in Malaysia. It has been banned in Malaysia. So when you use benzene and you use for degreasing, it is basically, it can cause you to have polyneuropathy. Polyneuropathy means many of your peripheral nerve is affected. It causes what we call the muscle loss. You can see the muscle have been lost, all right, and then basically he will have difficulty walking because of the foot drop. So stain removing for 5 months, unable to work, wrongly diagnosed as poliomyelitis. Poliomyelitis is a disease caused by a virus called poliovirus, where basically it also affects all your peripheral nerve, unable to walk, unable to breathe. But if you are not talking about exposure to chemical, benzene can be used for stain removal. You can basically cause polyneuropathy, when all your peripheral nerve are affected. Both means that there's both sensory and motor. It means you cannot walk properly. Your muscle will basically there's a wasting of your muscle, and sensory means that your sensation will be decreased. So it's both sensory and motor neuropathy, so polyneuropathy. And then the aromatic hydrocarbon is toluene. The effect is renal tubular acidosis, sinus depression, cardiac dysarrhythmia. Cardiac dysarrhythmia means your cardiac does not pump properly and cause reproductive effect. You will see that this TLV, TWA is 50 parts per million. Just now was how much for benzene? What is the TLV, threshold limit value, time weighted average for benzene? It was 0.5 parts per million, correct? So if you look at it, basically the more complex the chemical, the higher the allowable exposure limit. So if you have a bigger, longer chain chemical, then you have a higher exposure limit. When you have a higher exposure limit, means that you would be able to have a wider margin of safety. Remember the day we talked about margin of safety last week? So wider margin of safety. So if you use toluene is safer than benzene because of the your exposure is lower because the TWA is higher, or TLV TWA is higher, which is 50 parts per million compared to your 0.5 parts per million for your benzene. Xylene, another aromatic hydrocarbon. So all the aromatic hydrocarbon, the effect is almost similar. The CNS depression, eye irritation, the fattening, reproductive effect, and exposure limit ACGH it goes up again to TWA 100 parts per million, STER 150 parts per million. So the idea is that the more complex the chemical, it would have the margin of safety is bigger. That's why your TLV, threshold limit value, time weighted average is basically much more higher. So when we talk about time weighted average, we talk about 8 hours a day, 40 hours a week. So maximum for 40 hours a week. So this is called xylene, or your aromatic hydrocarbon. Of course, we have aliphatic hydrocarbon, consists of carbon and hydrogen molecules in straight chain. Of course, alkanes, aliphatic hydrocarbon with single chain bond, alkanes and alkenes. So basically single chain, double chain and triple chain. Example, pentane, N-hexane, hexane, heptane, octane, nonane. So it all depends on how many carbon atom is there. So pentane is 5 carbon atom, hexane is 6 carbon atom, heptane is 7, octane is 8, and nonane is 9 carbon atom that form the chemical. So N-hexane, in fact, N-hexane is basically used in a lot of chemical process, especially also used in healthcare process for when we want to do staining of the chemical. We want to staining of the tissue for us to come out with basically what we do is basically we use N-hexane to preserve the tissue for us to stain it, and so that we can see the effect of the tumors or things like that from the tissue itself. So N-hexane, the effect causes skin irritation, CNS depression, dermatitis, polyneuropathy, reproductive effect, and exposure. Exposure is basically TLV, TWL 50 parts per million. This shows that the N-hexane main use in footwear manufacturing. So the issue you must always remember, if you have a lot of cottage industry, you need to be careful of whether the cottage industry are using the chemicals specifically, or whether they practice the occupational safety and health effect. So this picture shows a mass outbreak of N-hexane polyneuropathy among footwear manufacturing in 1967 in Japan again. So what do you mean by polyneuropathy? As I mentioned earlier, it basically consists of sensory neuropathy and also motor neuropathy. That means the loss of sensation, and also you have what we call your muscle wasting, and then you get foot drop. So we look at this lady sitting on the right side of the your screen. Basically, it shows that there is loss of muscle mass and also foot drop. Foot drop, basically the foot, basically it means that this part is difficult for her to bring up the foot, all right, to maintain as a normal foot level. So when you have foot drop, when you're walking, then your slipper will basically be, you cannot, if you're walking with a slipper, the slipper will just fall off very easily because you cannot grip the slipper properly. So that's the first sign of wasting, first sign of foot drop, where you're walking, then you cannot control your slipper. That's where you get foot drop. So this is basically, look at what happened. N-hexane is one of the solvent. Actually, why is there N-hexane? Anyone? Why is there solvent there? What's the use of solvent in this context? Of course, in a previous context, benzene is used as a degreaser. In this context, what's the use of solvent? What's the use of N-hexane? Anyone?
Is it for polishing?
No,
Okay. Sorry.
it's okay. No worries. Anyone else? They are manufacturing shoes, correct? They are basically making slippers or your Japanese slippers. So look at it properly. They're making Japanese slippers.
Glue?
Sorry?
Glue?
Yes, glue. Why? What is the use in glue? Why is solvent present in anyone?
For quicker drying.
Basically, there's two types of glues. Okay, there's where you have water-based glue, and also you have solvent non-water-based with solvent-based. So you have this glue. The solvent is used as a how does glue actually works? How does your paper glue work?
Stick to
I
item
think
together?
the time for that.
Yeah, basically to dry, correct?
Mhm.
So basically when
Yeah, the time to dry will take.
so glue actually stays as a liquid, correct? So there's two types. There's normal type of glue. Glue stays as a liquid. For it to actually binds together, you need the liquid to become solid, correct? So that's why you need a chemical that allows it to dissolve, to make it liquid for you to apply, and you have shorter time so that it can stick together quickly. That's why you have glue. So that you need to put solvent in the glue, all right? So you can put water as a solvent, and your paper glue use water. Of course, you can use other kind of chemical like your aliphatic hydrocarbon or your aromatic hydrocarbon as a solvent that prevents that makes the glue actually more dry faster. So the faster the glue dry, the faster the solvent dissolve, the solvent evaporate, and the faster the solvent evaporate, the more dangerous the chemical is, because you would be exposed to the solvent for a faster, correct? So, but of course, if it's the longer the solvent stays also, that means there's a lingering effect when you are using your equipment, like your new furniture. When you buy new furniture, all right, sometimes you smell a lot of solvent because a lot of furniture currently they use what we call not wood, but they use compacted wood kind of timber, where from saw, not from saw timber, but from they basically glue the timber together. So there's a lot of glue inside there. So that's why there's a lot of solvent, and then the solvent get evaporated. So by the time only when is the solvent all the solvent get evaporated, then you don't get this problem. So the idea is that they use N-hexane as a solvent. The solvent is basically to dissolve the glue, and then of course then that's where the exposure is. All right. So the idea is solvent is usually used to make sure to keep the glue at liquid form. Of course, other type of glue is you got epoxy glue, correct? Epoxy glue is where you mix two chemicals together to create a chemical reaction for them to stick together. So those are different kind of glue, but these are glue that use solvent as one of the base equipment. So basic function. So basically, most of the glue that you see, basically you have what we call solvent. So there's another exposure that people use glue as a what we call misuse of glue. Anyone knows about that? Anyone knows how do you do glue sniffing? Anyone have done glue sniffing before? It's very difficult for me to know, because last time I would ask around, then someone would put up the hand. Okay. So what is glue sniffing?
I've witnessed people doing it. They put it in the bag, and then they cover and inhale inside the plastic bag.
Yeah. So basically what they're doing, they're sniffing what we call those solvent. All right. So there are solvent inside. So solvent, if you look at solvent, it actually causes CNS depression, correct? So the depression part of it is where where people want to feel good about it. So the CNS depression or CNS stimulation. It starts with stimulation, then it goes to depression. So the glue itself is not the glue, but the solvent within the glue. All right, most of them use the cow glue that for your shoe. All right, they put in a plastic bag, as Ananda say. They put in a plastic bag. They put the glue in the plastic bag. They shake the plastic bag so that the vapor form in the plastic bag, and then they sniff the vapor, and that's where they cause glue sniffing. And it's very dangerous, and it causes all this problem. All right, it causes skin irritation. It causes CNS depression. It causes polyneuropathy. It causes your brain to basically your brain cell to die, and that's where you get your encephalopathy. It causes encephalopathy also. It's called glue sniffing. Is where they use the solvent to sniff the solvent, because the solvent actually cause this CNS depression, and also CNS stimulation. So another form of chemical is aldehyde. Aldehyde is a disinfectant or preservative. Effect is eye and skin irritation, respiratory sensitizer, lung edema, possible carcinogen to human. Exposure limit is 0.3 parts per million. So aldehyde is another chemical. It's a simple H2CO. So aldehyde. So formaldehyde. So formaldehyde is used in we use formaldehyde in our anatomy department. We use formaldehyde in our mortuary, or where we basically do post-mortem. So all these are used basically in non-Muslim barrier. All right. So to ensure that you keep the body fresh, all right, for 5 days, for 1 week, or for a long period of time. So usually what they do is they cut off your femoral artery or femoral vein. So they cut, also one is femoral artery, femoral vein. They cut it off, and then they drain out all the blood, and they put in the the formaldehyde into the femoral artery, and that's where you get you replace the femoral artery with all formaldehyde. So the whole body is basically contains formaldehyde, and that's where you can preserve the body for a long period of time. We do that. We use that type of body when we are doing medical, when I'm studying medicine, where we basically do dissection. So we are exposed to formaldehyde all the time, and formaldehyde causes eye irritation, respiratory irritation, lung edema, carcinogen. It also causes degreasing of the hand, and that's why I get sometimes my tip of my finger get dermatitis, because last time when I was in India, when I was doing my medicine, we don't use glove, so that's why my tip of my finger it get degreased, and that's where it become a problem. So there's decreasing problem in the finger. So the ceiling limit is 0.3 parts per million. Uses in fixation or common found in most laboratories. So what by fixation is that when we get a sample of tissue, we try to make it to let the tissue so that the tissue won't degrade. So we fix it at the point of time, basically to preserve it lah. Basically more of to preserve it. So to fixation. That's the term preservative is not used, but we use the word fixation. We're going to fix the tissue so that the tissue does not degrade over time. So called fixation is commonly found in laboratories, in the morgue also. Dissection, as I mentioned, in dissection laboratory that we use. You know that sometimes they use formaldehyde and put it in fish. Have you bought fish that looks very fresh, but once you eat it, the meat crumple? Have you had that experience before? Anyone have that experience before? When you bought a fish from the market, not from supermarket, but from other market, from Pasar Malam, sometimes it looks very fresh, but you bring it home, when you cook it, the meat actually crumples. Have you had those experiences before?
Yes, sir.
So those are basically preserved by formaldehyde. All right. Those are formaldehyde. Basically, there's formaldehyde. You can use formaldehyde to preserve the fish. So the fish look very fresh, but because of the formaldehyde preservation. So it's not allowed actually So the Department of Health or our Kementerian Kesihatan actually do routine regular inspection and took sampling of fish, especially fish coming out from the fish that we import. We do it all the time to ensure that there's no formaldehyde inside the fish, or the formaldehyde level in the fish is very low. All right, so you use formaldehyde also to preserve food. So it's not, the danger is not that high, but it's not good for the food. So health effect: acute eye and respiratory irritation can result from exposure to liquid or vapor form. Severe abdominal pain, nausea, vomiting, possible loss of consciousness could occur if ingested in large amount. Chronic exposure to formaldehyde, high concentration vapor inhaled over a long period of time can cause laryngitis. Laryngitis basically inflammation of the larynx, bronchitis, inflammation of the bronchus, bronchial pneumonia. So you get a pneumonia, basically inflammation of the lung. Prolonged exposure may cause conjunctivitis, inflammation of the conjunctiva, or your nasal tumors have been reported in animals. Formaldehyde is suspected to be carcinogenic. So other kind of aldehyde is basically you have glutaraldehyde. Glutaraldehyde is another disinfectant, basically used to what we call cold disinfectant. You used to sterilize instrument and washing X-ray films, affect the eyes, respiratory, asthma, dermatitis, and the exposure limit is basically 0.05 parts per million. So the problem with glutaraldehyde is not just irritant, but also it's a allergic. It can cause allergic asthma. That's why it is basically the level is lower because of the allergic properties of the glutaraldehyde. So glutaraldehyde is, we try to remove glutaraldehyde from healthcare industry already because of the effect of it can cause allergic asthma. I think later Masuki will discuss about what is the allergic asthma. So what's the user? Sterilization of instrument in operating theater or procedure room, as I mentioned just now. So the scope used for colonoscopy or scoping up, down, or gastroscopy, scoping from up, basically sterilized using glutaraldehyde. Health effect: acute health effect consists of irritating the eyes, the skin, and respiratory tract. Chronic health effect: repeated and prolonged contact may cause dermatitis, may cause a skin sensitization. Also, exposure may cause inhalation. Because of the sensitization, you can cause occupational asthma. So when you're exposed to this glutaraldehyde, you can lead to your what we call occupational asthma, which is you sensitize. Is quite the problem of glutaraldehyde induced occupational asthma is basically a major problem for people working with glutaraldehyde in healthcare industry. Alcohol, methanol. All right, of course, methanol you cannot eat, you cannot drink. Methanol causes blindness or optic neuropathy, impaired vision, CNS depression, dermatitis, exposure, TLV 200 parts per million, STEL 250 parts per million. So biological monitoring, methanol in urine. All right. So methyl alcohol, so it continues to convert to methanol in urine. Ethyl alcohol, ethanol is basically your normal alcohol that you consume. Of course, ethanol, it causes CNS depression, respiratory eye irritation, fetal alcohol syndrome. When you basically, if you are pregnant and you drink alcohol, you get what you call fetal alcohol syndrome, where it affects the fetus. All right. So this is not recommended to drink alcohol when you are pregnant. Okay. Exposure limit is 1,000 parts per million. Ketone. So another kind of chemical called ketone, chlorohexanol, characterized by mean odor, produced by dehydrogenation or oxidation of alcohol. So the irritant occurs at level below CNS depression. The effect is eye, skin, and respiratory irritation, CNS depression, dermatitis. Dermatitis is the skin irritation, skin sensitization. Exposure limit ACGH is 25 per million skin, and SEL is 50 part per million skin. Skin, that means they take care of skin exposure. Vinyl chloride. Vinyl chloride is another chemical used to synthesize polyvinyl chloride. Effect is respiratory tract irritation, scleroderma, light changes, or acro-osteolysis involving tip of the finger, angiosarcoma of the liver. Basically, angiosarcoma means cancer of the liver, and exposure limit is 1 parts per million. So where can you get vinyl chloride monomer? Is basically during the synthesis of polyvinyl chloride. Polyvinyl chloride is actually plastic. Also, if you can get vinyl chloride monomer by basically burning plastic, where you get a fume from burning plastic. All right. So polymer fume is where you get when you burn plastic, and if you're burning polyvinyl chloride, you get vinyl chloride monomer. So you get the effect of respiratory irritations, scleroderma changes, also angiosarcoma, basically cancer of the liver, blood vessels in the liver. Other industrial solvent, glycol, phenol, ethers, ester ether, glycol ether, amines. This basically there are a lot of other industry solvent that is available that causes, depends on the solvent. It has different kind of toxicity. Like phenol causes cytotoxicity, corrosive thermal absorption of vapor. Ester causes optic neuropathy, like methyl formate or methyl acetate. Ether is extremely low, volatile, flammable, and explosive. Glycol is the skin absorption, repetitive toxicity, amines, irritants, corneal edema, and visual halos. So the idea is, do we need to remember or do we need to know all these things? Not really. Basically, we need to know how to read the information I provided today, and the previous class is basically related to how do you assess your or read your MSDS, and how do you understand your MSDS, and also on the effect of the chemicals on the body. So your SDS is a safety data sheet. So we understand that any chemical you use in the workplace, any metals or any process you use in the workplace, you must have a SDS or safety data sheet, and the safety data sheet will be able to have 14 elements, and inside the elements or title or topic, basically you will look at it, and then you will come up with what kind of toxicity or what is there. All right, so we will basically look at it. The other one is chemical interaction. So one chemical interact with another chemical, and like your degreaser flush, injection of alcohol followed by exposure to trichloroethane. Trichloroethane inhibits breakdown of alcohol, leading to transient rash of face, neck, and upper chest. So so the idea is that you must understand the interaction between chemicals so that you can advise your workers not to be exposed to N-hexane causes peripheral neuropathy due to metabolite 2,5-hexenodane. Methyl ethyl ketone potentiate the action of N-hexane, and also methyl MNBK also causes peripheral neuropathy. So the idea is you are exposed to two chemicals, whether two chemicals have an additive effect or not, or whether the two chemicals act independently. If the two chemicals act independently, then you access the two chemicals independently. But when the two chemicals have additive effect, like your N-hexane and your methyl ethyl ketone, which basically act on the same effect, or whether it is interacting or not interacting, you need to combine it together, and you need to assess it as a single chemical. That's why you need to add the two level of exposure together as one. Right. This one, if you are doing chemical health risk assessment, it is in the guideline for chemical health assessment. Right, there's a additive effect or interaction between the chemicals. That's where you need to assess both chemicals together as a one chemical by adding the two effects together to see whether the two effects actually exceed the level acceptable or not. Last, we'll go to pesticide. All right, so pesticide is quite, we go through a little bit, not so detailed. Are you okay with chemicals?
Okay, sir.
All right. So now we look into pesticide. So pesticide are biological active chemical designated to control pests. Basically, that's why it's called pesticide. So what is pest? Pest can be viral. Basically, most of them is fungal, bacteria, or rodent. All right. So they are used to protect the supply of food and its wholesomeness, to safeguard the public's health and to protect buildings and other structures from harmful pests. So pesticides are chemicals used for destroying or preventing spread of insect, noxious plant, fungal, microbes, viral and bacteria, and rodents. So all these are called pests. So they're called pesticide. So depends on what type of chemical or what type of pest you want to prevent. You can classify as an insecticide, herbicide, fungicide, antimicrobial, and the last, of course, is rodenticide. All right. So your insecticide consists of organophosphate, organochlorine, carbamate, pyrethrin, pyrethroid, nicotine, rotenoid, microbiological agent like Bacillus thuringiensis. Herbicide like trichloro and dichlorofenoxibicid, urea derivative, carbamate, triazine, and glyphosate. Fungicide like carbamate, organophosphate, ketone, ketophol, pentachlorophenol, iprodium sulfur elements. Antimicrobial includes triazine, estrione, chlorine releasing agent, chlorine, and dichlorobenzene. And your rodenticide contains like cumidine derivative, anticoagulant, triacylene, and fluoroacetate. So the issue is that insecticide, herbicide, and fungicide, these might not affect a human to that nature. But when you talk about rodenticide is basically rodent is mammals, so it's more dangerous when you talk about rodenticide compared to insecticide or herbicide. But insecticide and herbicide still is of a danger involved. So organophosphate, carbamate, organochlorine, pyrethrin, and pyrethroid are some of the insecticide that we use and that we have used or we are still using. So organophosphate is basically acetylcholinesterase released by So acetylcholinesterase is basically a chemical released by presynapse bind to the receptor postsynapse. Binding result opening of ionic chamber and depolarization of postsynaptic membrane. Acetylcholine is then released and hydrolyzed by acetylcholine enzyme. So organophosphate actually inhibit acetylcholine enzyme, and that's why your acetylcholine persists. So if people who is exposed to acetylcholine, all right, basically people who are exposed to organophosphate, the first thing you have to do is you have to ensure that before exposure you must take the acetylcholine esterase level in the body. So and then you want to see whether there's increased or decreased level after exposure, because you want to see whether there is effect of organophosphate that inhibit acetylcholine esterase. So it persists in the body. So the idea is that you need to look at the level. So it shows that there is any poisoning. So what does it do? Basically, it has nicotinic effect and muscarinic effect. Nicotinic effect, it causes twitching, weakness, paralysis, diaphragm and chest muscle. Muscarinic effect, it causes respiratory secretion, spasm, and myosin. Myosin is basically where your pupils become small and doesn't react to light. It causes a central nervous system tremors, confusion, slurred speech, disequilibrium, and convulsion. So basically, these are exposure to high dose of organophosphate, and you get all this effect. But there's also exposure to chronic level. Basically, chronic means that you're exposed to a lower dose of organophosphate over a long period of time. You get neuropathy or axonal damage or central and peripheral nerve. So motor more than sensation, distal more than proximal. So damage of spinal cord, constrict peripheral visual field. As we mentioned earlier, visual field, that means your field of vision, your sight, you cannot see sight properly. You can actually only see become narrower. Your visual field become narrower. Mycopathy, psychiatric disturbance like acute psychosis and severe depression also be affected. We will talk about organophosphate poisoning. So organophosphate are used as a insecticide. All right. Carbamate also is used as an insecticide. Organic compound derived from carbamic acid. So carbonization of inactive acetylcholine, but for shorter period of time. So basically, which means that carbamate is safer than organophosphate, and symptoms similar to organophosphate, but the recovery is comparatively rapid. Organochlorine is another chemical. Organochlorine example is DDT. Anybody remember what is DDT? DDT is dichloro-diphenyl trichloroethane. What is it used for? Basically, it's used to, it's a pesticide. It's used to control pests, but actually what we use DDT for in the healthcare industry is used for surface spraying. We spray it on the surface of the house so that we can basically prevent malaria, Anopheles mosquito, which is basically that carries malaria, and we want to reduce the Anopheles mosquito that in for as a pesticide. So management mosquito is what we want to control. The problem is that DDT is prolonged. It stays in the body for a long time. It stays in the environment for the long time, and it accumulates in the environment. It's bad for also for birds, for other species of animals. That's why DDT is now not used anymore in the control of malaria, as part of the control of malaria in Malaysia, also worldwide. So, but it has less toxicity than organophosphate, less toxicity than carbamate. It's stable in the environment and bioaccumulate. That's why the problem that's why it cannot use. It's highly lipid soluble, accumulated in fatty tissue, which means that there is a bioaccumulation. When talk about fatty tissue, remember just now we say that when the chemical actually accumulates somewhere in fatty tissue, we get bioaccumulation. That means it accumulate. That means you can have DDT in your body for a long period of time, and it slowly can get released. But the effect is still smaller compared to carbamate and also organophosphate. So CNS depression is there as a stimulant. Acute irritability is stimulant. Dizziness, tremors, convulsion, headache. Chronic effect, you get tremors, loss of memory, and personality loss. Basically, sometimes you get different personality. Others like estrogenic effect. Basically, what do you mean by estrogenic effect? A lot of chemicals now present in the environment. There's also a lot of chemicals that is discharged into the water. That we have what call that estrogenic effect of the chemical. All right. So what do you mean by estrogenic effect? Anyone? What's estrogen? Anyone knows what's estrogen? Okay, estrogen are chemicals that is like androgen. Androgen is an enzyme for male, correct? Estrogen is the female enzyme. So estrogenic effect is basically the chemical looks like the estrogen, and it have the effect of estrogen. That means when you are exposed to those chemical, you develop female characteristic in a male. All right. So this will happen in animals that you can see it, but also in human, you might develop breasts and things like that because of the estrogenic effect of the chemical. So of course, it also can cause carcinogenic and teratogenic. Pyrethrin and pyrethroid. Pyrethrin and pyrethroid is basically another chemical. Pyrethrin and pyrethroid is used all the time. If you look at the insecticide you use at home, the Richset and everything, the Bygone, basically they are all either pyrethrin or pyrethroid. Pyrethrin and pyrethroid are derived from chrysanthemum. Chrysanthemum is the same chrysanthemum tea that you make. When you boil chrysanthemum with water, you get chrysanthemum tea. But when you boil chrysanthemum with oil, you can get pyrethrin and pyrethroid, where you extract the pyrethrin and pyrethroid from the chrysanthemum. That's why it is important that you know what you do with it. So It's used for household pet control, mosquito, lice, cockroach, and fly control. So these are some of it causes allergic dermatitis, rhinitis, asthma. So organophosphate and carbamate sometimes added to ensure insect kill. So there are small amount of organophosphate and carbamate added to your pyrethroid and pyrethroid for killing of insecticide. Another one is ethylene oxide. All right, so this is different from pesticide. So pesticide basically we only discuss insecticide. All right, this ethylene oxide, a cyclical enzyme used for oxygen atom in cyclic CCD. Right, this one you can skip this, no problem. All right. Okay, so we finish with toxicology and principle of toxicology for this first one and second session. So any question, anything you want to discuss or ask?
Prof. We have some exposure. Let's say like we have like an exposure of the chemicals, right?
Right.
So we have like a acute and a chronic effect from those chemicals.
Right.
So how long do you consider this a chronic effect? Like what, 10 years or 20 years or how long?
Depends on the chemicals. Usually chemical not 10 years or depends on the effect. Let's say can be a year. It can go chronic. 3 months also can be called chronic. All right. So basically, you're exposed to small amount for a period of 3 to 6 months, 8 months. You can get chronic effect like your asthma. All right. It can start with irritant. Irritant means that you're exposed to a high amount. You get irritant asthma. But later it can develop into what we call allergic, and the effect stays on, then it becomes chronic. So it depends on the effect. But of course, cancer, it will take around 20 to 30 years. So the effect, you look at the effect, there's different effect. So the different effect, the timing will be different. The acute effect is where you're exposed to it currently. All right, that means for the current period, not to say 1 or 2 weeks, but if you're exposed to high dose for this time, what effect you get? Those are called acute effect. Chronic effect is where is over smaller dose over a longer period of time, can be few weeks, can be few months, can be few years, can be 10 to 20 years. So it depends on the effect you are focusing on. As I mentioned,
Thanks, Prof. Thanks, Prof.
Respiratory effect, asthma, you can get irritant asthma, which is directly, or you can get the irritant can continue become allergic asthma, which is basically 3 months or 4 months down the road. Okay, thank you, Umar, for the question.
Thanks, Prof.
Hi, Prof. Usually in powerhouse, they use liquid diesel to clean the engine parts and all that. Is the effect of this liquid diesel same or similar to the effects of benzene?
No, diesel is much less volatile compared to benzene. All right, so the effect is less, but exactly the effect we need to look at the CSDS. That's why when you talk about, are you working in power plant, Ibrahim?
Yeah.
So you need to look at the SDS first before actually you use any chemical. So when you look at the SDS, okay, then you will basically be able to look at what type of effect the chemical have. All right. Okay, so this is cyclohexane. So this is a chemical called cyclohexane. Remember just now we have N-hexane. This is basically the cyclical form of the N-hexane. So it's called cyclohexane. So this is called SDS. So you need to look at basically what are the. So there's number one is basically identification of substance, mixture, or supplier. All right. Then number two is hazard identification. So this is a flammable. Okay. So it is health hazard, irritant, and environment damaging. So flammable means that you need to store it properly. So the issue we worried about is health hazard as an irritant. So these two basically, irritant means you have a acute health effect. So irritant, skin irritation, and category 2. And flammable liquid. All right. So and environmental damaging also. So you look at number 2. What's GHS? Global harmonization of chemical. basically GHS, global harmonization, and normally the thing should look like this. This is how global harmonization the sign should be, but these are other signages that is not global harmonization. So composition of chemical. So first aid measure is the one that you want to see if you were talking about something related to health. So what do you do? All right. But if you want to look at the health effect, is on this one. All right. This is the health effect. So you got to read this and you can see the health effect of the chemical. So you want to look dermal toxicity. So if you look at it, acute toxicity, no, it's little dose. 50% of the experimental animal would basically die from dermal exposure to more than 200 milligram per kg. So this is basically very high. So it's not that dangerous. Inhalation, basically 13.9 milligram per liter, 4 hours. So inhalation is by concentration, see or not? So inhalation is always by concentration. So liter inhalation concentration, red is 13.9 milligram. Oral is 500 milligram per kg. This is for liter dose also. So oral is always liter dose. So when one you want to focus on is when you focus on environmental exposure or occupational exposure is the liter concentration. So this is the number you look at. So what is high, what is low? So you can read the information in the guide. The CHRA guide will tell you which is high, which is low. So chronic toxicity, no additional information. Corrosion, no additional information. Sensitization causes skin and eye irritation. So it basically causes irritation. So that means that you have irritation, single target organ, no additional information, mutagenicity, mutual effect occur in microorganism, and no additional information. So the idea is that you have to look at this part of it for you to see whether your diesel actually have problem or not. All right, so this diesel SDS, okay. So it is a flammable, it is an irritant, it is a health effect. So you look at this. These are basically called hazard sign. These are the new way of writing at it. So causes skin irritation. That means you should not expose to skin, correct? Fatal if swallowed, so you cannot swallow it. So it may cause drowsiness and dizziness. May cause cancer. May cause eye and damage and irritation. So this is what we call classification of the chemical. And you go to number 10. Okay, this is different. Sorry, number 11. So you see that acute toxicity, LC50 is only 6 milligram. Just how much? 13 milligram. All right, 6 milligram acute toxicity. Derma, this is liter dose. Oral, liter dose. All right, so the same. So acute toxicity. So what it said? Skin corrosion area prolonged and repeated contact may cause irritation leading to dermatitis. Liquid may absorb through skin in toxic amount if large amount of skin exposed repeatedly. So eye causes serious eye irritation, no sensitization, no classification. So teratogenic, also carcinogenic is IARC group 3. What's group 3 again? Not classified, correct? That means they have not classified yet. Reproductive effect not classified. Toxic effect not classified. Inhalation exposure may cause drowsiness, dizziness, and inhalation. Aspiration hazard. Because aspiration breathing difficulty means if you drink it, it causes breathing problem. potential health hazard, vapor, irritating eye, nose, throat. Ingestion may cause gastrointestinal disturbance, vomiting. In severe cases, tremors, convulsion, loss of consciousness, coma, respiratory arrest, and death may occur. So the vapor will cause irritation, eye, nose, and throat. So basically, that means that you cannot expose to the vapor. Okay. So all these things is so you must. So what is taught today, or these two classes, is for you to be able to read this only. You understand?
Yes, Prof.
Yes, Prof.
So you must.
Yes, Prof.
So you must basically able to understand all the information given here, all right, and understand that what is the effect on it. So single exposure. So the main problem is irritation. Exposure may cause drowsiness. Sorry, inhalation exposure may cause drowsiness, dizziness, and by inhalation. So these are basically called acute exposure. So there's no chronic exposure effect here, because it's not carcinogen. That means this product, but must make sure that the product is the correct product, because it might be the different product that you're buying, but this product that is supplied by Global, it's called diesel fuel, all right, is actually less toxic compared to what we call compared to benzene, correct? But it still causes irritation. Of course, if you eat it, you die. It causes drowsiness. It damages eye and irritation. That means if you expose it to the eye, it basically causes demonstration. May cause cancer, but they say may cause cancer, but the information actually does not in the H. They say may cause cancer, the H classification. But if you look at number 11, when it's more detailed, it doesn't say that it causes cancer. It's IARC 3, correct? So it's not considered cancer. HEGIH 3 also confirmed animal carcinogen with unknown relevance to human. So A3. So the idea is that it does not cause cancer in human. So it is safer than benzene. There's still some inhalation exposure problem. So you need to reduce the chances of inhalation. So do you wear any PPE when you're cleaning?
Yes, Prof.
What PPE you wear?
The mask and gloves.
What mask? What mask?
The one with the filters.
The respirator, the one with the cartridge filter, is it?
Yes, Prof.
Then you're safe. All right. See or not? See all these things? All right. And then they will tell you what to wear here, correct? How to reduce exposure. Respiration. Approved air purifying respirator, organic vapor. So you must use organic vapor respirator. Cartridge. All right? Or canister. You know what is that or not? I think we're going to discuss this later, correct? We discuss it later, then we'll look at it. So you got to use an organic vapor cartridge or canister. That's the minimum you have to use. So there is basically the thing you have to use. So the glove also you got to know what kind of glove you can use, So you can use nitrile glove, neoprene and PVC, So you cannot use natural rubber, So are you using natural rubber or nitrile, neoprene or PVC?
The PVC one, sir.
So you're using correct glove, so it's okay?
Yeah. Okay. Thank you, Prof.
So the idea is that you need to, you as a safety health officer, you need to be able to read this, understand this, and then implement this. All right. So SDS is important. So the whole 2 class is basically to teach you how to, not to teach you how to read SDS, to teach you understand toxicology and what's the relevance of reading when the information is presented in SDS. Okay, thank you very much. Hope that you all have find that the class is useful. All right. So I will see you again when I see you.
Sorry, Prof. Just a quick question.
Yes.
Just now we were discussing, you were explaining on at the LD50 LS.
LC50 and LD50.
Yeah. Is that almost the same thing as when you discuss about TWL, TLV?
Different. LD50 is where you decide TLV, TWV.
Sorry?
LD50 is when you decide what is the level of TLV, TWA, and TLV STEL.
Then
LD50
exposure limit.
LD50 little dose at 50% is where you do experiment in the animal, correct?
Yeah.
So 50% of the animal will die at that dose. That means dose is basically only for ingestion and for skin, correct?
Yeah.
Concentration is for inhalation, correct? Remember that?
Yes.
So 50% of the animal will die at that dose. 6 milligram, is it? 6 milligram per liter per kilo, something like that. All right, 6 milligram. So for that concentration, because concentration is basically how much the concentration of chemical in the air. All right. Dose is how much you consume. Correct.
Right.
So 50% of the animal will die. So based on that 50% of animal die, there is a calculation on how much you're supposed to be exposed to, so that you won't be affected. So there's two issues here. The TLV is threshold limit value, is basically based on ACGRH, and it is TWA, means time weighted average. So level below which that means let's say the level of benzene is 0.5 parts per million, correct? Remember that?
So the lower
level below if you're exposed to level below 0.5 parts per million, you are safe.
Yeah.
Not at 0.5 parts per million, below which you are safe.
Yeah.
That means if you're exposed to 0.5 parts per million, that means you need to do something already. Okay. So the LD50 and LC50 is different. So for you what you want to learn some more about this, basically, if you go and take out the maybe if I got time, I will show you the chemical health risk assessment guidebook. All right. Do you have that book?
No.
You can download that book. The version 3. And inside the book, basically, they'll tell you what to consider dangerous based on LD50 and LC50. Okay?
Okay.
Anyone else want to ask question? If not, I can go. I don't want to keep you too long. I think you got a class at the 12 o'clock, is it? Okay. Thank you very much. See you again next time. Bye.
Thank you, Prof.
Thank you, Prof.
Thank you, Prof.
Is it going to be a test?